do. And as many of you know, last year we hosted our first transition summit, and it was really quite a success. So we were able to get it started again. And we're so pleased to be able to invite all of you to attend today's summit. So I'm looking at the chat here. So if you could pay attention to that. Crystal, I know you're trying to do a number of different things here. So if we could have the next slide, please. So what we hope to achieve today with our summit is that those of you attending, one, will understand the health equity issues affecting culturally diverse communities, learn strategies for promoting successful transfer of care to the adult systems of care, gain insights on the lived experience of accessing adult-focused care, acquire new knowledge on health-related accommodations for work, training, and education, and learn more about immigration, public charge, and benefits for undocumented individuals. Next slide, please. This summit, in terms of being able to offer it in Spanish, Mandarin, Korean, and ASL, would not have been possible without the funding support of the WITH Foundation. So we're really grateful to them for providing the funding to enable us to offer it in these many different languages. Next slide, please. We have a very full day. And our first panel is our parent panel, and they will be talking about issues of health equity and promoting health literacy. And we have some really just well-informed experts in terms of the lived experience, and those who are some of our colleagues from Iowa. So let me just go through the names here. We have Karis Lee, who's the grant manager of Being Built Together, which is a Korean parent support group. Lorna Eaton, who is a parent navigator at the UCEDD. Vanda Young, who is the board president of Chinese Parents for Children with Disabilities. I don't think I said it exactly correctly, and Vanda will be able to correct me. And Tammy Emsbaugh, who's a program manager at the Iowa UCEDD Center for Disabilities and Development, and Ann Crotty, who is a program coordinator and health equity expert at the Iowa UCEDD Center for Disabilities and Development. We also have other presenters, Dr. Christine Mirzayan, who will be talking about health passports and locating adult providers. Next slide, please. We have a consumer panel that I'll be introducing later this morning. We'll have a lunch break, 40-minute lunch break midday. I will be speaking later about health-related accommodations in education, training, and employment. And we will conclude the day with Joan Chang, who will be speaking about immigration, public charge, and benefits for undocumented individuals. So without further ado, I'd like to hand it over to our parent panel. So,
hello.
Thank you. Are you going to share the slides? I think Crystal.
Yes.
Thank you.
Perfect.
Thank you.
Well-
Thanks, Cecily. As she said, my name is Ann Crotty. Topic today is promoting health equity and culturally responsive care and health literacy within the transition to adulthood. They asked me to go through a little bit of some of the terms and things that are really important to find out about equity and health literacy and things like that first. So I'll do a quick overview. Next slide, please. Few disclaimers. First of all, we are all still learning, including me, even though Cecily introduced me as a health equity expert. Definitely know that I still have a lot to learn on this topic, and that also the panelists are going to be sharing their own experiences, and not everyone from the different cultures that are here or people from those cultures will feel similarly. So there's a lot of diversity, even within different cultures, of different experiences and perspectives and things like that. And finally, we have no conflicts of interest to disclose. Next slide, please. A few terms. It seems like a lot of these terms are often used sometimes interchangeably, when I feel like it's really important to know the differences between some of these terms. So I'm just going to pull out a few of them. Culturally responsive care is like healthcare that considers and respects perspectives of the individual and recognizing their specific and unique cultural and linguistic needs and perspectives, and recognizes that that can differ between one person of within the same culture to another person based on experiences and other factors. So it's really a back and forth process between a healthcare provider and a patient or family to help learn about their perspective. Another one would be implicit bias, or stereotypes or attitudes that affect our understanding and actions and decisions. We'll talk more about that later. And then another one that I realized is not on here, but it's super important, is health literacy. And that means the degree to which people have the ability to find and understand and use health or information or services to make informed health decisions and take informed health actions. Next slide, please. So this is an equity continuum graphic that I found at the Colorado Office of Health Equity. I found it was super helpful in thinking about the differences between some terms that are often used interchangeably and recognizing that they are not the same. So diversity is kind of like a snapshot, a picture in time of description of your differences. And that picture in time varies over time, of course. Inclusion is what you do with diversity. So it is possible to be a diverse organization, but not an inclusive organization. If, for example, if people within your organization don't feel like there's representative decision-making, as an example, that's an organization that might be diverse, but not inclusive. Equality is giving everyone exactly the same thing, which we'll talk about more later. And equity is leveling the playing field, or making sure that everyone gets what they need. Next slide. This is a quote that we found. It's hanging up in our office because I love it. But Verna Myers is the person that said this, but diversity is being invited to the party and inclusion is being asked to dance. Next slide. This is just another representation of that. You'll notice at the top, everyone with the bikes has the same exact bike, even if it doesn't fit them or doesn't meet their needs. As at the bottom, everyone gets a bike that is the right size for them and is what they need in order to actually use it. Next slide. The Robert Wood Johnson Foundation, which developed that previous graphic, also took it a step further to provide information on disability more, because they got a lot of comments about application to disability. And so they came out with this one on the left that talks about or shows the image of people crossing a street. and there's not a curb cut. There's only a pedestrian walking sign, which doesn't use any verbal or visual signals to communicate that it's safe to walk. And on the other side, there's a curb cut, so it's more inclusive. And then also there's an auditory signal that you can cross now, it's safe, and then a visual symbol too for people with different needs. Next slide. Intersectionality is a concept that recognizes that everyone has a really unique mixture of experiences and diversity and different factors about them that makes up who they are and their perspectives on life. And so the quote from Kimberly Crenshaw, who coined this term, was that intersectionality is a lens which you can see where the power comes and collides, where it locks and intersects. It's the acknowledgement that everyone has their unique experiences of discrimination and privilege. And there's this pretty graph that shows, or image that shows the intersection of different factors like race, ethnicity, gender identity, class, language, etc. Next slide, please. So intersectionality, the compounding effects of discrimination and for people from different communities that have more than one social identity that's oppressed. And so that leads to even greater inequities a lot of times too. So the implication for us is that we need to work from the margins and approach that with intersectionality and understanding that if we don't consider the people that are most vulnerable, then those people that are most vulnerable are going to fall through the cracks in our interventions, and we will inadvertently reinforce disparities. Next slide. This is a diversity iceberg graphic that just shows, even though things like skin color and race and gender are factors that are really easy to notice about people, or seemingly easy to notice, there's so much below the surface that are really important to learn about people and their experiences and perspectives and things like that, that are not obvious. Next slide. A quick exercise, I saw this somewhere else, but a father and son are in a car crash and are rushed to the hospital. The father dies, the boy is taken to the operating room, and the surgeon says, "I can't operate on this boy because he's my son." How is that possible? Does anyone have any guesses?
The surgeon is his mom.
Yes. Yeah, so have you seen this exercise before?
Yes, I cheated.
Yeah, yeah. But so if you had trouble with this or if you hadn't seen it before and had trouble or things like that, don't feel bad, because most people have lots and lots of trouble with this, and they come up with all these elaborate explanations, like maybe it's a Catholic priest and, you know, all these different things, but they forget the most obvious one, you know, because it's implicit bias. Next slide. Yeah, so implicit bias are attitudes or beliefs that affect our understanding, actions, and decisions in an unconscious manner. And this can impact how we recall and process information. So even the people that are the most well-intentioned people and that have a lot of diversity within their own experiences, every single one of us has implicit bias about different topics because we exist in the world and have a whole life, you know, outside of our work too. Next slide. So there are some things you can do to reduce implicit bias and be aware of your biases. So that's the key thing, is recognizing that we all have biases, but we need to be aware of them is the big thing. So there's a test that you can take. It's called an implicit association test. We have a whole bunch of different tests for different areas of diversity, but just reflect on those results and how they might have come to be. Next slide. And some ways to reduce implicit bias other than being aware of them are just things like being aware of what situations might be prone to bias, like if there's ambiguity in policies, or if you're really distracted, like with time or a lot of pressure, or also really tired and things like that, which specific for that are implications for healthcare providers. We know what it's like within a healthcare system with limited time, lots of pressure, people that are tired and hungry and overworked, you know. So healthcare providers especially need to be aware of these factors. And then also things like meaningful exposure to people that are different from us. Next slide, please. Okay, next we have our panel, our family panel. Okay, we have Karis Lee and Vonda Young and Lorena Easton. Is that right? Or Eaton? Okay, next slide, please. So for our first question, we're interested in knowing, how does your culture understand and experience disability and also intellectual disability? Who would like to go first?
Okay, maybe I'll go first. This is Vonda. Maybe before going into disability, maybe I can just briefly talk about at least the Chinese culture. And I love it, Anne, when you noted for us to make sure whatever I say is not a general rule for everybody in the Chinese community, because we have so many subcultures within us. So yeah, myself is from Chinese Parents Association for the Disabled, and I'm a mother of a 35-year-old Down syndrome. So I don't represent all the parents of all types of disabilities either. And I'm originally from Hong Kong. So, you know, that's another subculture. But in general, there's a tendency, I want to talk about the cultural values that a lot of us Chinese families hold. And I think one big difference from the Western culture is we are like community oriented. We are not individualistic like the Western culture. And then we value bringing honor to the community and to the group and to the family. So, and then we honor, we're supposed to at least respect and honor authorities, you know, those who are, you know, on top of us. So in terms of this, it also, what impact us is our communication style is usually one way, just top down, and there's a hierarchy. So that really affects how we relate to service providers and health providers. Thinking a lot of times we think that, you know, doctors, you know, they are up there and they know a lot, and we're not supposed to ask too many questions and question them. That will mean disrespectful. And then I think also our culture, we don't want to be different, stick out like a sore thumb. You know, one example I share with the team is left-handed people are, you know, kind of like want to shun upon in the old days because we use chopsticks and we usually eat in a round table. And if you use your left hand to do chopsticks, you'll be poking the one next to you. So that's not cool, right? So, you know, that's just a fun illustration, but not to stick out. So with that as a backdrop, that kind of impact on, you know, how we look at disability. There's just generally very stigmatized toward the disabled person, and that's kind of will bring kind of shame to the family. And I remember when I have my daughter, gave birth to my daughter, my mom told me, don't tell anybody that she has Down syndrome, that she's disabled. But I share that with everybody so that I come across, because that will be better than hearing it, behind my back. So anyway, that's the stigma that our culture has. And we have families, and families share their pain even to this day, not the old days, not in the back home country, that disabled person is being abused or, rejected. But, even here in the US, they come over here. Some of them, their own family have a hard time accepting them, really rejects them. It's a really sad story. One 10-year-old kid, the mom shared, now he's an adult. But when he was at 10, the family just could not accept him having autism, and some of the behavior that's connected to it. And the family keep calling the police, every time there is maybe a act out. Ended up, the kid was taken into a mental health hospital. He was locked down for a whole month and so traumatized. So these are some of the things that some of the families would encounter, but because of the respect to providers, they might not reveal it, readily, because that will be kind of shameful too, So yeah.
Thank
So
you so
that's
much, Vonda.
Yeah.
Thank you for all those insights.
Yeah, just one other thing that impact related to disability is also mental health, because a lot of times those two kind of go hand in hand. The older they are, a lot of times our kids develop mental health, issues, and that is also shunned upon. That's a stigma connected to mental health. When you think about a recommendation, let's go see a counselor. They'll say, no, counseling, mental health treatment, that's for the crazies, it's for people who are in the asylum. So it's really difficult, when that, a lot of times that will come on, as they grow older, or things that happen. And that impact on the health issues, assessing.
Thank you,
Thank
Vonda.
you.
Guadalupe or Karis, do you have anything to share too?
Yeah, actually kind of going off of what Vanda said, the Korean community also, they focus a lot on, being the community. And also they if we go back to like the roots of Koreans, they really take pride in being like a nation and sharing one language and sharing similar values, and they hold like a strong sense of unity as well. So when there is, if something is different from the general norm, it could be hard for one to accept it. And so Koreans, like, they really aim towards reaching towards the standard of society, and going back to like our history, like, being in the war and surviving those conditions. Like, I feel like for Koreans, like it's part of like us to be so competitive, like in our roots, because that's what we had to do. Like, you had to be really outstanding in order to survive and to excel. And so even when like now, first generation Koreans come to America, and even though they're influenced by Western culture or being surrounded by it, they still have those thoughts in their roots of, going towards the standard and trying to excel in those ways. And so they're overall, there's still like some societal stigma and misconceptions, and even though like the 1.5 and second generation, you know, they're becoming a little bit more willing to seek resources and support, but sometimes it's still hard for parents to seek out those resources, or even what Vanda was saying, like, you know, don't ask questions to the expert because they're the expert. And so just taking in what they tell us and going out with that is some of the things that, you know, we experience in the Korean culture. And, you know, like Vanda said as well, this is not like everybody, but just like some parts that people experience as well. Yeah.
My experience, my name is Lorena. It has been a little bit, you know, I would say harsh in the way that my aunt had a disability. He had ID, and we live in Mexico. I was born in Mexico when my and my mom came to the United States, and then we stayed over there with my grandma and 17 other siblings. So my aunt had ID, and during that time, we never knew what was wrong with my aunt or what, but she was not allowed to leave the house. She lived in the room. We would go and play with her in the room. They would give her a book or a catalog, like a Sears catalogs. I remember she loved those, and we could not touch those because they were hers, but she was just inside the room. She was never allowed to go out there, you know, and into the community, or we had parties, she had to stay in the room. She was just not allowed to, and we never asked why. We just kind of took it like, you know, kids, oh, well, you know, she's in trouble, you know, time out. And, but she was always in timeout, you know. So when we came to the United States and my son got diagnosed with autism, I told my mom that my child had autism. And my mom says, oh, he's going to get better. And I said, oh, yeah, I know he's going to get better, but I want to tell the whole family. I want to have a family meeting. And she goes, no, you dare not tell the family. And I said, but why? They're going to know. It's not something we can hide. You know what I mean? It's like, you know, if when I was pregnant, I tried to hide it for a month and everybody knew. So this is even worse because this is not just for 9 months. We're going to have to hide it for his whole life. And she would say, no, you know, the family's not allowed. Wait until they ask. And when you ask, we're going to tell he's sick. And I go, Mom, I cannot say my son is sick because he's not really sick, you know? So this boy is the most beautiful boy ever. You know, he's walking around, he's, you know, jumping around and then the couches, you know, and doing inappropriate things. But, you know, he's a kid. He's a child with autism. And I noticed that people were asking what's wrong with Matthew. And I always say things like, there's nothing wrong with Matthew, you know, there's nothing. He just has autism, you know, but he's a child and he's playing like the child. Maybe he's not doing everything what the other children are doing, but, you know, he's happy. He's enjoying life, you know. So one of the things that I realized is that I had to train my own family to work, you know, with me to tell the community that, you know, Matthew has a disability and that Matthew has different needs, but he's going to be okay and he's happy. My main objective was happy. So we start going to family parties and to the family, and we start talking about my aunt, that what was that we want to do the same thing to Matthew, that what we did to my aunt. And everybody was like, no, why? Well, we didn't even know why my aunt was locked in that room and was put away like nothing important, you know, like not like a human being. So one of the things that I always struggle was with the people that keep saying that my child is sick. My child is not sick. You know, my child may have autism, but it's a human being. It's a young adult who lives life, and that he's really struggling, you know, with certain social encounters, because he's not very, you know, socially aware of other people's needs. So, but he's a great person. So yeah, it has been a struggle. But one of the things that I realized that when we let our people go into, when Matthew got diagnosed, and well, I put it in a circle, you know, and my whole family was allowed to come, and there's certain people that were not very nice or were not accepting that, they were going away, you know. So we start, you know, kind of not alienating, but also we will start to making choices of what people we want to have, what part of the family we want to have in our, you know, in our circle, you know. And one part of that circle I realized is that we just wanted our child to be accepted. His dad was not in the circle because he never accepted my child's disability. One of the issues that I always say, authority, the doctor was a partial, he was a big part of my circle because I trusted the doctor. He accepted my child. He helped me. He gave me a future for my child. He gave me a trajectory. He said he's going to be okay. And I really believe him, you know. And, you know, when I had to change doctors when he went to adult, that was very hard. It was like I got divorced again because I never going to see him again because he was really part of our lives. So it's very important to understand, you know, and to care for not just our family, but, you know, our community.
Thank you.
Thank you. Thank
Yeah,
you so much. That's so much information. So
Those are
much. Thank you all.
powerful stories. Another question. Tammy, go ahead.
And just a second, I would like to call attention to some of the information that's in the chat about some of this stuff. It's really good. I don't know how that chat should be shared. I really don't think we have time to read them all, but take a look. Go ahead, Ann.
Tammy. So another question I have is, what are important factors about transition to adulthood within your culture?
I can continue if they'll let me. One of the things that I realized that the factor, like I said, during transition is that that circle, you know, you really, if you have 2-3 people there, you want to keep them. You don't want them to go. And eventually when they transition, they're leaving, you know. The doctor has to do a new doctor, you know. The school ends, this teacher that was part of that circle has to move, you know. The therapist, now they have to have adult therapists, so they have to have different therapists, you know, that before they were given by the school, they're not there anymore. And as you know, I asked my child what was the main, who's your friends? His friends always the therapists, the doctors, all the people that spend the most time with them. So it was very hard for him to let that go, you know, and knowing that his whole routine is going to change, but also that his life is going to change because he's an adult and he needs to go to a different doctor. He needs to go to, you know, a different school, college, university, and, you know, he's going to have to get new people in the circle. So it's very, very important to understand that when we don't like it. I think for me was the hardest thing emotionally and mentally to accept that all that I have built through the years. You know, I started at kindergarten and then middle school and then high school, that, you know, I had a good setup of services. Now I have to start all over again, you know, and I start all over again with no knowledge. And a lot of our families feel that they don't have nobody out there to help, that we, especially like children's like, okay, bye-bye, you have to go, you have to move to adult care and see you, you know, and today's your last day, or CCS is ending and you have to go to somewhere else. And they said, where has authority figure, they always send us, where do you want us to go? What do you want us to do? You know, we want somebody similar to what we have right now. I want to feel safe like before. So it is very, very important to help our families to understand that, something new is not bad. You know what I mean?
Right.
So
Yeah.
we're gonna have to work a little bit better, but I mean a little bit more. But eventually they're gonna, we're gonna get used to what it was normal back. That is not normal right now.
Thank you. I want to
Thank
go to
you.
Rhonda and Karis.
Yeah, I really, it echoes so much from my heart from what Guadalupe just shared. Yeah, it's really traumatic for families, for myself when we had to make that transition into all the adult providers. And it's really stressful. And then on top of adult providers, then, for our families, some of whom are limited English speaking or monolingual speaking, it's even harder, finding, like navigating, bilingual, health providers. And then on top of it, it's like navigating the insurance, all the, Medi-Cal, service, because then you have to find Medi-Cal providers, adult providers who are bilingual. So that makes it really challenging for families. And then on top of it, I think is to the transition is like when they are still minor children, seeing the doctor, parents are right there, right, answering the question or taking all the health care. And then, but then with the transition, we have to supposedly help our kid to take more independent steps in taking, over the health cares, hopefully, making some small decisions or encourage them to talk to the provider directly. So, but then I guess culturally, since we don't like to ask questions too much ourselves, that makes it really hard to be aware of that, to encourage and train our kids to make that transition and that self-determination, making, decisions, healthcare decisions, such as that. So personally, I'm aware of, I'm doing that, when I was transitioning, and I realized every time I go to see the doctor with my daughter, she would, every time the doctor asked her a question, she would look at me, and just expect me to answer it for her. So I would have to turn away, but she wants me in the exam room, so I would turn away, and so she would, have the direct relationship with the doctor. And after many, many years, at least now, sometimes she would feel comfortable enough to be in the exam room with the doctor herself. So that's a transition, for our kids making those decisions, and even taking shots, before is I take all the initiation, right? Hold her down and give her the shot and let her scream her head off. And the whole building will hear. And now I try to, step away. I will do the shot myself, like COVID shot. I will do the shot myself. So be the example, and then I'll go outside and let her do it herself. I'll hear her scream a little bit from outside, but that type of transition, I think we as families, need to learn about, but then it's more of a struggle for our families. Yeah. So, and then mental health is another issue that, the culture, because of what I shared before, it's, the culture can drive us both ways when our kids get older. Either for kids who have less need for support, there's a tendency to go for higher education and more education, more achievement. And the kids who need less education, there's that cultural myth and misconception that from the deficit model that they can't learn anything. It's disabled, you know, so they don't have any abilities. So there's no, that will impact on the employment first policy that now we are pushing out, because families, they don't see the ability in their kids. You know, it's such a deficit model that yeah, so we won't see the possibility, then we won't even, you know where to ask, or what are some of the resources available, or even navigating those resources for our kids. And so that's the other cultural challenge, you know, in terms of disabled for our family. But the other one, the achievement, that also impact on the mental health for our families, when it drives so much toward achievement and education. We see some families actually brought on the kids, brought on the onset of, you know, other mental health issues
Yes.
during this transition period, and then a delay in seeking, you know, help because of those stigma toward mental health. So
Boy.
yeah, unaware of the stress that it brought on to the kid,
That's
also to ourselves.
really a lot, Vonda, and it's a lot
Yeah.
of good stuff. I want to give Karis a chance here at this question also, so we can come back to that. Karis?
Thank you. Yeah. In our culture, Korean parents are, and throughout all the stories that I'm hearing, like, I know that parents are very, very involved with their children's lives from a young age. And also in the Korean culture, like, they want to do everything for their child. And especially parents who have a child with a disability, like, they feel sorry for their child. Like, sometimes they're feeling like guilt, like, did I do something wrong? And because of that, even more, they want to do like everything to protect their child. And at times that it leads to the parent feeling that their decision is the best decision for their child. And so they want to be protective of their child. And even as they become an adult, the parents desire to continue to live with their child, because they know that if their child is with them and next to them, then they can protect them and they can continue to care for them. And the feeling of knowing, like, this is what's best for my child, because I can be right next to them and make sure that, you know, everything is good and everything is okay. And so this is, you know, as a parent, they feel that they want to care for their child until the very end, until they possibly can. And then this can impact that transition into adulthood, because they're not fostering like more independence or giving them more opportunities to make their own choices, because they feel like, as a parent, like, I want to make this best decision for you. And that is one of the cultural factors that we found that could impact the transition to adulthood.
Thank you.
Mhm.
That's
Thank you
powerful.
all.
So another question I have, and I'm going to actually combine our next two questions into one, but thinking about, what do you want case managers or doctors or others to know? And also, do you have any recommendations to improve our system of care for youth and young adults with disabilities that are transitioning to adulthood?
Can we start with Karis this time?
Oh,
Go
yeah.
ahead.
I was gonna
Go ahead.
About your culture.
You know, going off of what Vanda said as well, I think Korean people, they generally, like, they hesitate a little bit in asking for help and expressing their needs. So if they need something, they don't really ask. And so, you know, we see situations where parents don't have respite care, and, you know, it wasn't offered, but also the parent never asked or expressed their need for help. So it was never mentioned. And then, you know, it doesn't, and the parent won't ask. So it never happens. And you know, you can say that Koreans exhibit some kind of shyness or a little bit of hesitation in asking for help. So it would be nice, like, if professionals could approach them first to see and offer, like, this is what's available. Is it something that you might need or want for your child? And also for like going into the fourth question, for example, respite service, the service coordinator comes to the house, and when it's someone of a different culture, like coming into your home, sometimes even like the smell of your home can feel very like uncomfortable. So if, you know, if like, even for me, like when I want to invite someone over, I put candles on because, you know, I cook Korean food all the time, and I get self-conscious, like, oh, does my house smell like kimchi, you know? And I live in a, like, most of the people around me are not Asian, you know, even Asian. And so I'm like, oh, what if my house smells and they think it smells weird? And this is something also that, you know, that the director shared with me, that parents express this. And so it would be so wonderful if there were someone who were Korean, you know, so they would be more open to inviting somebody into their home to get this transition going. And then of course, like the primary thing is the language barrier, finding resources. It could be hard. And so as they need to make new plans and goals in this transition into adulthood, if they have someone of the same culture who speaks the same language, it just makes the process more comfortable for the individual and the family. And even for like the self-determination program, like because of the lack of independent facilitators that are bilingual, it makes it harder for the transition. And so, you know, even if that itself, like the Korean speaking and understanding the Korean culture, that would play a big role in making the transition smoother. And one last thing is for translation and interpretation, sometimes the translation, it sounds really weird. Like the way that the words are formed in a sentence, it's like the opposite of English, of the English language than what it is in Korean. And so when you translate something, it's like you're saying the end of the sentence first and the beginning of the sentence at the end. And it just sounds really weird sometimes. And so what we've been doing at BBT is we have somebody that goes through the content before the webinar, or like before we have a webinar, we have a translator go through the content before, so they understand what's being said. So when the seminar is going on, they know how to translate it from one sentence. You know, they can listen to it and translate it in the correct way so that parents get the correct message and it's not so confusing. And so those are some of the things that, you know, we thought of that would be great.
Thank you.
Thank you.
Vonda?
Thank you.
Actually, this will fit really nice into the chat that Drenna Belger from Redwood Coastal Regional Center had just put in the chat. That's one resource. I think that's really great for our families. That will kind of lead into, she said that there is a booklet for teenagers, transition booklet for teens and young adults leaving the childhood medical and educational systems, something like that. But I'm just thinking too, like we really need, for the system, for policy, or, you know, for service providers who have that capacity to provide all these. There are a lot of education materials out there, and our community really need health education, but then we need it in the language. So the health education out there, you know, if that can be translated into the language we need, will be great. And like Kara said, make sure the translation is culturally and linguistically relevant. Even though I have to say, Google Translate is getting much, much better now. So, and we use Google Translate and then we edit, back check it and edit it. So, so that's one piece. But for providers, relating back to the culture, the way we communicate, I think we are so used to talking casually, and sometimes we in our interview, in our casual interview, we might use double negative questions and try to avoid that with the Asian families. I say Asian because I work with the Japanese families and they face the same thing. One example is like if you ask, oh, you don't get no support for her, you know, so if she really doesn't get support for her kid, she will, for English speaking, will say no, right? But for Asian, we will respond with a yes. Okay, so that will cause a lot of miscommunication, misunderstanding, right? So try to just make very simple, positive statements and questions. I think that will help with the interview, the assessment, and also try to, I guess, I would suggest to clarify, since we are not very open in expressing ourselves and asking questions or asking for clarification, it might help to be more proactive in clarifying what you explain to them, and try to rephrase and reframe what you explain to them. And a lot of times we are trying to be very polite, and because we honor and respect our authority, our doctors, and we will be agreeing a lot of times, even though we might be disagreeing inside or not understanding. So yeah, when we do that, don't assume that we understand what you're talking about, the instructions, the impacts of the health issues. Take time for the interview, the work with the ethnic minority families, and I think building trust is very important, and I think that usually I see it from my own family, my own parents. It's easier for them to trust if they see that you're really doing them some favor. Like in our culture, we do gift giving, right? So they might give you things during holidays and special events, and it's not to bribe you. It's just culturally we have that to show our appreciation, and it's okay if it's not great amount of money to accept it. It's graciously, and you can say we share it with the office staff or whatever. And yeah, so but I really love what Anne talked about, the implicit bias. I think I have them, and I think it really impact on the work, the support, the service that we provide. So I think be mindful of that. One example is like if your patient is a really highly educated professional that comes in with a kid, doesn't mean that they know everything. And they might not ask you any question, right? Doesn't mean that they already have it all figured out. No, well, I mean, it's no. So those type of things. Yeah.
Thank you.
So our check our
Thanks
own
so
self.
much.
Yeah.
I see we have a question, Maria Marquez, and also I want to give Guadalupe a chance to respond about recommendations that you have to improve the system of care for people of different cultures specifically, and also anything else that you want case managers or doctors or others to know. Maybe we could go to Maria. Do you still have a question?
Yes, I do. I wanted to say I appreciate everything that you guys are saying. I am a person with a disability. I've been in the regional center system since I was in high school. And I remember when the service coordinator went, and my mom only speaks Spanish. I mean, she understands English when people are talking because she's been here for so many years, and my mom's already in her 80s. But what I do want to say is that when I first started with Regional Center, I mean, I knew I had a disability, but I didn't want to be honest because I was afraid, oh, I don't need this and I don't need that, because I wanted to be so independent on myself. Um, but now that I'm older, I'm honest, and yes, my disability has worsened because of my cerebral palsy, even though I've done exercise, but because of all the fallings I've had. And now I do use a walker at home when I'm at home, and I use a scooter out in the community. But it's like when I was little, I didn't want no services because I wanted to be as normal as the kids in my neighborhood. So I'm just coming from a perspective as a consumer with the disability. And I know the parents are there to help, but I would always like want to be as much as independent as possible. And I want to know, how do you parents feel about that?
Thank you so much. Good question. Good question.
Guadalupe, do you want to start? We have about 4 minutes, I think.
Yeah, let me just answer a little bit. I wish my son is a nonverbal. He speaks just few words and everything. And I wish he would have a different way to communicate it, because I really want to know what he feels. But when I see people just making choices or saying you're going to go there or you're going to do this without considering his needs, that's when parents say, no, I know what he needs. I live with him. And I know that your mom loved you so much that she wants to protect it, even though when you don't want to be protected. And that's the same thing I do with my kids. Every time they go out, I said, okay, no drinking, no doing this, that. And they're 30, and I call them and make sure that they're doing that. So that's, I think that's just a mother thing that we do. But on the questions, how long do we have? Because this is my passion. This part of how can we change? How can we do things better? How can we include everybody? First of all, to the doctors, I love all doctors, and I work with them every day. But they need to take a shield pill, okay? And this is why they need to take a shield pill. They go in the room, and 5 minutes they're out. That's not the way. I've been here 20 years. I want to have a little more extra time with you. I have questions that I want to ask you, and I have some concerns. So I want them to listen. And don't start with, oh no, this is the services. No, start with, what do you need? What do you expect? What do you want? How can I help you? And I do would like the transition to be planned. Don't just do one or two, first give information. What do they need? They need information about SSI, information about future neurologists, everything. Get the information out. Then come back and 6 weeks and everything, and see did they understood the information. Check back. Do you need any extra help? Are you doing okay? And then do the movement, not just do the movement and then hope that everything work out because you give information. There are children, we have the transition bridge clinic, and it's working. And I can tell you it's working really, really well, but it's not complete. It's not something that I can say, oh yeah, it's wonderful. Yeah, it is wonderful, but it's not done. We have to work in a lot of pieces and put it together. The first thing we do is we talk to the family to see whether their needs, if the child moving to an independent home, is he staying home? Or, what did the child wants? If he wants to go to school, I always take the time to ask the child, the adult, the son says, what do you want to do? Do you want to work? Do you want to go to school? Because maybe the parents never ask him that, and I asked, what's the trajectory? What do you want in your future? for our families, especially for our Latino families, we never plan. And I understand because as children, we have a lot of very sick patients, and they don't want to plan for 10 years if they know they're not going to have 10 years with their child, you know? So they are afraid to plan for a long term, you know? And I tell them, no, let's just plan for next week. Let's plan for like, you know, 2 weeks, 3 weeks, whatever you have, but let's have the best life that he could have or she can have. So we always talk to the family to realize, and in the room we have a medical home personnel, we have a doctor, and we have me, and we have the nurse, we have everybody that wants to be part of it, you know. But yesterday we had a transition call, a transition meeting, and
What happened?
Guadalupe, we're getting some background noise. I think, is everyone else hearing that too?
Yeah, I was just gonna.
Yeah, I'm not sure that it stopped. But can you, okay, yeah, it stopped, I guess. So I don't know what it was, but do you want to continue?
Can I also make one
Yes.
suggestion for providers? I think it would be great if health care providers can collaborate with community-based organizations serving families with disabled kids, and make those resources available in the office, and refer them, because sometimes they might not tell what is going on in the family with the provider, but with another family, it might be easier. So help make that connection, since they respect you as the service medical professional. It might be easier to help them make that linkage.
Yeah, and one of the things that we always do at children, that what we do is that, like, I'm very familiar with, I work with Fiesta Educativa, CPAD, other organizations that that work specific with this group of people. So what we do is that we always tell the parents, and we tell the physicians, you know, if you don't know the answer, if you don't know how can help these people, send it to somebody that knows. Don't just say, oh, I don't know, and that's it.
Yeah.
Parents always need help finding, you know, resources, or they feel more comfortable going to CPAD or to going to Fiesta Educativa or to other organizations if they know that they're going to be helped in their language, and people like them are going to be helping them out. Sometimes that's all it takes for that family to achieve, you know, the goal that they're expected. But yeah, planning, it's very important. I don't think the 1 or 2, you know, sessions, transition sessions should be. I think it should be more. It should be also, we have a guy at Children's, this transition guy, and right now we're trying to translate in other languages. But it's very important to give that information, but maybe the family's not ready to receive that information at that time. So what we do is that we check back. You know, right now it's only Social Security. Okay, just look at the Social Security part. Don't look at the whole book. It's going to scare them. It's going to scare because everything is new. So we only want to do little parts, little by little. Make sure that you just, you know, just work on the Social Security part. Or housing, you know. Housing is a big thing for families because they don't want to let the kid go and live alone, but they think that they're ready, but they can just not, you know, understand why he wants to go somewhere else if he has everything here at the house. You know, so those are the things that we have to kind of lock together with the families, and just give them the information, and for them to decide which information they want to, you know, use at that time. Also for the providers, you know, to look at the whole dynamics of the family, you know, look at the child, look at the family, look at, you know, to see what that they, you know, that the family really needs at that specific time, and don't just throw in more problems. If the family is having mental health issues and everything, send them to that. Don't just give them, okay, you have to move to another place, because that's going to bring more stress onto the family. So what we need to do is to just know when they're ready, transition them when they're ready. The guide it's a great tool because it can be used all through his life, the child's life. Also, make sure that you have this information in multiple languages, and if you don't have it, try to get as much as you can. And if you can't do it, then yeah, send it to CPAS, send it to Fiesta Educativa, send it to other organizations that work with that specific group of people, because we want to make sure that they get the right tools so they can, be successful in life. But for the pediatricians, my idea would be that we have a transition doctor, pediatrician, adult doctor and still pediatrician, have meetings with the pediatrician and the adult doctor and the
Yep.
family. But I've been trying, and they, every time I say that, they just say no, that's, it's for some reasons that's not possible. But you want to ensure that when you throw the ball, make sure that person catches the ball and holds the ball. Don't drop the ball, because you don't want that ball to be dropped and the family be with no services or
Thank
not.
you so.
Thank you. So we have about 4 minutes left. I wanted to see if Karis has any thoughts on this.
Not really. I mean, I'm just going along with, what I said earlier about
That's okay.
yeah.
Are there any other questions or thoughts? Questions from the audience, or either any of the
Yeah.
other panelists have other thoughts? And if not, I have a question too, I guess.
I
Thank you.
do have just one
Oh,
note
Wanda, go ahead.
for providers, like for dental providers, dentists, because I run into that and I missed that completely myself. And I didn't know that actually for dental care, there's a cutoff age for special need disabled young people. So it actually dental care would cover orthodontist treatment for special needs, the teeth problem, up to 21. Then after 21, then you lucked out. So these are some of the health information, I think, that benefit, health related benefit information that I think families need to know, that should be out there. Because I checked the dental care site, they don't have it in Chinese or other languages. So,
Mm. Right.
Thank you. So I was wondering about, so back to the cultural factors about transition to adulthood, how different markers of transition to adulthood, such as living independently, and also things like concepts like self-advocacy, how those might be interpreted differently between different cultures. Vanda,
so
for
the Chinese or Asian in general, we tend to protect our kids, or like the culture, we don't want to make waves. So advocacy, we don't even have that word in our language before. It's a new coined word now, advocacy. So that whole concept of advocacy, even for parents, is a new thing when they come to US to learn themselves. And so it will be a big transition to help families aware that the advocacy is not just the parents' responsibility, but transitioning, helping parents to transition that mindset that we have to support and educate our kids to advocate for themselves. Like Guadalupe just shared too, like, self-determination. Actually, it's not way up there because of the self-determination program, but it can be down at home. Start from home. Start from something very, very simple. Going out to eat at a McDonald's, encouraging our kid to order for themselves, and slowly pay for themselves, and even applying for EBT card, and then go to the market and start using that, and a lot of families says, oh, we have the ability to pay. And I said, you know, I do too, but I'm thinking like long term when I'm not around, I want her to be equipped now and learn how to take care of it herself. And then when I'm gone, she'll be, you know, one less thing to learn to be independent. So independence starts at home, start young, you know, at birth, kind of as soon as possible. Yeah. And then yeah, and then we need the family to rally around that, and service provider also need to know that, to encourage the caretakers to look into that.
Thank you so much. Thank you, everybody. I think we have about maybe 1 minute for some closing comments from anybody.
I just want everybody to know that they're not alone.
Right.
As a parent, just as the independent adult needs help, also the family needs help to let it go. You know, I always tell my mom that I want Matthew to live independently. She says, no, that's your job. You know, you didn't leave the house until you got married. Somebody else took care of you. Like, no, mom, I've been taking care of myself all my life, you know, but that's the way that she thinks. And I don't want my children to think that way. They can be independent. They can take care of themselves. And I don't have to die for them to realize, okay, now I have to do it everything by myself because my mom is not here to do. You want them to start early because that way you will be able to help them.
Thank you so much.
Yes, thank you, everyone. This was a wonderful discussion. And our time is up.
I totally am just so grateful that all of you participated, and Tammy, Vanda, Lorena, and Karis for sharing so openly that lived experience in terms of helping to support your children and others as they, you know, grow and enter into adulthood. So thank you so very much for this really inspiring, informative, and really helpful panel. So thank you. And I just want to say we have a 10-minute break now before our next presentation by Dr. Christine Muzayan, and that will start in 10 minutes. So if you come back at 10:23, we'll move on to our next presentation. So thank you all again.
Thank you.
Thank
you,
you.
Cecily, and everybody.
Thank
Yeah,
you.
hopefully our kids will all be asked to dance.
Right.
Zion.
Hi.
Good morning.
Hi.
Do you want to just,
Sure. Do you want me to just start?
let's see, are we, let's see.
Yeah, 10:23.
Right.
Okay. Okay. All right. Hi, everybody. I'm Dr. Christine Mirzayan, I'm a pediatrician at Children's Los Angeles, and I work closely with Dr. Betts and Lorena Eaton and Crystal Ash. And I am here today to talk about not an easy subject by any means, but definitely putting some ideas on the table and things that we can think about as we face the very challenging problem when we are trying to transition our, as a pediatrician, as my patients, and as family members, your family members, or self-advocates yourselves, from pediatric care to adult care. And what are some of the questions you need to ask, and what are some of the general principles that we can apply to this, again, challenging process. So I will go ahead and start the slideshow, and then because of the windows and everything, it's sometimes hard to see the chat during the presentation. So I will answer any questions from the chat at the end. Okay. So I'm going to be talking about healthcare passports and some interesting examples that I've seen, and locating adult providers. And I'm just going to adjust something on my Zoom. So and then I will. Okay, so one important question is, and I get this from my patients, it's not always an obvious answer, is when do I need to switch healthcare providers? And so this, probably the first person to ask is the actual provider that you're seeing at that time. The reason being is because there's some variation. So if you are seeing a pediatrician, some pediatricians will be able to see that individual up until 18 years of age, and others can do up to 21. And so some of it is based on the pediatrician's practice and kind of what they allow, what the insurance allows, things like that. So it's important to know that when you're seeing somebody, and my families that I see, we try to talk about it. I try to remember to talk about it early, ages 14 to 16 would be a good time to bring it up. And in my practice, I can see patients up to 21, but sometimes 18 is a better time to transition. So there may be variation by the individual and what's going to make the most sense for them. So that's if you're seeing a pediatrician. If you're seeing a family practice doctor, those doctors are trained to see children and adults. So some family practice doctors can see families through their whole lives, from infancy to adulthood and late adulthood. So that's something to consider, and definitely a strength for family practice doctors. And again, it is something that may vary by your provider, and so something to ask early when you're starting to think about what's going to happen when this individual becomes an adult. Sorry, I went 2 slides ahead. There we go. Okay, and so the other big thing to think about an individual becoming an adult is what is going to happen to their medical insurance. So there is a switch at 18 in some sense, and in this conference, as we're focused on individuals with disabilities, many individuals will have SSI, and usually their Medi-Cal is linked to their SSI. Now, at up to 18, that SSI determination has to do with the whole family's income, but then at 18, it's the individual's income. So there usually is another application process or form to fill out by 18 to determine the SSI, and then that will end up influencing the Medi-Cal. And so this is something important to think about, as an individual is reaching 18, kind of making that plan for converting the SSI to that individual. And then that will then lead to the Medi-Cal conversion. And this can get confusing and can vary, by exactly where you live and exactly what health plan you have. But again, these are some general principles that I want to bring up. Like Vonda said, sometimes it's hard to know when the dentist insurance will change. So I'm talking about the medical side of things. And some health plans, especially through private insurance, may allow that individual to stay on the parent's health plan until 26. So that's something to consider as well. One of the FYIs for your information that not all parents are aware of is that California Children's Services, which is a kind of an additional type of insurance, as well as it provides other services, that actually ends at age 21. So that's really important for a lot of our families to consider and to be prepared for. So this is a question I get a lot as a pediatrician from my families. They say, are you going to send me to a new primary doctor? The reality is that I can make recommendations or suggestions, but that decision is really up to the individual and their family where they are going to continue care. And of course, the ultimate decision depends on sort of the legal status and is there conservatorship, and in that case the conservator would be the one to make the decision, but hopefully in collaboration with the individual. But it is not completely up to the primary pediatrician, the primary doctor as a child, to refer or send you to a new primary doctor. It really is the choice of that person turning 18. And given that it is a choice and it really is up to that individual, there are some important things to consider. And like I said, as a pediatrician, these are some things I'll walk through with my families as we're reaching this age. So one thing is that to kind of know what insurance that individual has, and is it a managed care plan or is it fee-for-service Medi-Cal? Medi-Cal is California's Medicaid program. This is important because the primary doctor has to be in that health plan. So if you have Medi-Cal with HealthNet, the primary doctor you want to see has to be part of HealthNet. Same thing with LA Care, for example. And usually if you are assigned a health plan, which is happening more and more now, this is where Medi-Cal is really going, is to try to get most people enrolled in a health plan. You can switch health plans if you, again, have a certain doctor you really need to see and they are under one health plan and not the other. And that you can do through calling the number on the back of your insurance card. Within that health plan, it's a little bit easier to switch primary doctors. You can also do that. Sometimes the health plan may automatically assign you to someone you don't want to see or is not going to work for you. And then you can call that health plan to switch. It's important to think about this when you're just, again, understanding what insurance you have, what health plan, and then knowing that the doctor that you want to see has that, it takes that insurance and has availability. Again, a lot to think about. That's why planning ahead is important. And I just want to get some of these ideas out there. Super important for individuals with disabilities and other medical conditions, you may need to see a specialist. So for example, you as a child saw a neurologist for seizures, and so are planning on needing to see an adult neurologist or an endocrinologist for it, maybe something like diabetes. The key with managed healthcare plans is that all of these referrals to specialists go through the primary doctor. So again, working backwards, if there's a certain specialist you need to see, when you're making the decision about your primary doctor, you want to make sure that primary doctor will be able to refer you to that specialist. So that's something definitely important to think about as you're planning on switching primary care. The other thing, and I've heard this from some of the adult doctors that collaborate with us in these community-based efforts, is that the model of adult care is slightly different than pediatric care. And so in the pediatric world, we do tend to send to a lot of specialists for any complex medical condition. The adult doctors, their training includes handling more of these things because they're more part of normal adulthood. For example, high blood pressure. As a pediatrician, I may not do high blood pressure by myself. I may have a specialist see that patient. If I'm an adult doctor, many of my patients have high blood pressure. So I may just handle that myself. And the same thing with diabetes. So I've heard from some adult doctors that we should prepare our patients as we send them to the adult world that not every medical condition is required to see a specialist. This is also a good conversation to have with your current specialist if you have a neurologist or a cardiologist, and to ask them as well, where they think you need to go for specialty care as an adult. And then again, try to find a primary doctor who can help make that happen for you. So kind of to sum up some of the things about what to think about when you're choosing an adult provider. Again, it's what specialist can they send you to? Another important question, especially if you have a lot of medical complexity, a lot of medical conditions, are what hospitals could that doctor admit you to? Where are they associated? So that if they saw you in the office and needed to send you to the hospital, would that be a hospital you're comfortable with? Another great question and something to think about, does this doctor take care of other members of your family? Often one of the first things I'll ask families when we're talking about transition, I'll ask the parents of my patient, who do you see for care? And is this someone you feel comfortable with? Is this someone you like? Is this someone who would take on your child? And then that might be a great option because the doctor already knows your family and you have some trust and some understanding established with that doctor. So that's a good option. Once you see a primary doctor, I want to emphasize that if that is not working for you, and I know Lorena does a great job telling our families this, if this isn't going to work, if they're not speaking to you in a way that you feel comfortable, if they're not treating you with respect, you can change doctors. It is a process. You'll have to call the health plan, but it's something that you should feel empowered to do, that you do want to find somebody that really fits and makes you feel comfortable. All of these things, really do come into play when you're thinking about legal decisions. And if there's conservatorship, then obviously the conservator is making these decisions, but in collaboration with the individual. If there's not a conservatorship, but the individual wants help or definitely wants somebody with them to make these medical decisions, make these medical appointments, there are other options, such as having a medical power of attorney, or sometimes just written documentation that this individual is to accompany the other to visits and be involved in medical decision making. Another important point to consider is when you, let's say, go to the office before you make that decision, before you put that doctor as your primary on your insurance. Go to the office and look around and see, is this somewhere you would feel comfortable? Is it accessible? If you have equipment that you need to use to come to the doctor, do they have space for that? Now they really should, and this is an advocacy issue. If they don't, I would go into it in a few other slides. They really should, and maybe that should be something reported if they're declining care because there's not accessibility, especially if they receive federal funding for some of their work. So it really, the offices should be accessible, but I want individuals to be aware of the situation they're going into with a new primary doctor and check it out before you make that decision. And again, feeling that you do have the ability and the power to change if that situation isn't going to work. I hear this all the time as a pediatrician when I either have adults going out into the adult world or from other family members or just from the community, that sometimes when individuals go to the doctor, they may hear from the doctor, oh, I don't treat your condition. I don't know how to treat your condition. And I've received questions, why not? Is there a certain extra certification? The reality is that some doctors have training in different areas and specialize more in one area versus the other. But for primary care, doctors really should take any patient and be willing to learn about their condition if they don't know about it. So if you run into that, and if it's not a doctor you're going to feel comfortable with, then it's okay to move on. But if this is someone you want to see and they are telling you, oh, I don't know about your condition, that's time to push that doctor to look it up. They have lots of tools, there is lots of information, and they can learn. And oftentimes you are the expert on your health condition, and you can offer your expertise of your own body and say, well, this is information I'm going to share with you. And I really want doctors to also feel empowered to, when they don't know, ask, look it up, reach out to a colleague, and that their not knowing should not be a barrier to your care. Talking to my colleague Lorena about this, there are ways, if you kind of want ideas, or if you say, I could educate this doctor about my condition, but I'd rather see someone who's really experienced with this. I would encourage to look at any specific foundation or resources or community-based organization that serves the condition related, if there's a condition related to your disability, because sometimes they do have either lists or recommendations of doctors that others have experienced to be kind of really good with that condition. So these are some examples where you might find some additional information for a good fit for a doctor for you. So Autism Society, Autism Speaks, Cerebral Palsy Foundation has a lot of good information, Childhood Cancer Foundation, Down Syndrome Resource Foundation, and Epilepsy Foundation. And I encourage you as well to ask the regional center, your service coordinator, if they don't know, if they receive enough questions, maybe eventually they'll start to kind of put those resources together and know that this is something important for families. And they may know of other clients who see doctors in the area that have been good and that they've had a good experience. So they may have some recommendations as well. So that's a resource I also encourage families to seek out when looking for an adult provider. So in terms of finding this fit and then making sure this new doctor knows your medical history, it's important to know that medical records are very important. I get some families that assume because their charts are online, that the next doctor will see that. The reality is every clinic, even within our hospital, our clinic versus our hospital, they have different systems. Maybe one day they'll all talk to each other, but we're not there at this moment. So it is important to plan on being able to provide medical records to your new doctor. I'll tell you, as a doctor, we can request those records. They don't always come as quickly or as easily as you would think. So if you want to be as prepared as possible, it is nice to request those records from your clinic and your hospital. They may have two different systems. You may have to ask both early. And then that way, when you see the new doctor, they have that information and don't have to be at that first visit saying, well, I really need those records to figure this out. And then they go back and ask. It's nice to come in prepared. Doesn't always happen. We understand that, but these are the little hints that can make the process a little easier. The other thing I'm trying to get my families that I work with to become more familiar and comfortable with is that there are a lot of more options now for patient portals where the individual can log into their medical record themselves and often access the medical notes. So that may be a way that you yourself can get your medical records and information and give those to your next doctor. If you can't get the full records, or it's 500 pages and that's just not realistic, another really important step to consider is asking your current doctor to provide a summary for you. And ideally that doctor's talking to your next doctor and can provide the summary to the doctor. It may not always happen if they don't have that ability to communicate with each other. So you may be the one that carries this information between one doctor to another. And sometimes that's the most direct way. So you can ask your doctor to kind of do a summary of your medical condition, what your diagnoses are, medications, what specialists you may need to see, any major surgeries or hospitalizations you've had, and equipment needs. So this is sometimes what we'll do with our patients who are going to transition. We'll make sure one of our doctors at the minimum writes a summary. We always try to get the medical records, but first, that has been a difficult kind of task through the years for many reasons. The other thing that this is something that you can do on your own or a family can do together is a healthcare passport. And I have a couple of really cool examples that have been made with an individual with a disability, and specifically developmental disabilities in mind. So what's a healthcare passport? It's basically a source of information that you can provide to a doctor who doesn't know you, or if you're in an emergency type of situation. And so this could include contact information for you, your emergency contacts, and who are your support members. For example, if you have a really good relationship with the service coordinator at the regional center, and if there was a medical emergency and you would want someone to contact that person, that's something that you could put on your healthcare passport. Diagnoses, medications, allergies are extremely important. If there's information about advanced care planning, who do you want to make medical decisions for you if you're not able, that information can be there. And then taking the next step of like who you are as an individual, what's important to you, your likes, dislikes, if there's some important sensory issues that you would want somebody to be aware of, then those are things you can put on. So actually through the ACL, Administration on Community Living, they have a nice resource, and I have the link here, and then I have kind of an example, a blank one and then a nice one filled out. So this is something you can find online, print out, and include information, personal information, who is your legal representative if that's the case, and contact information, insurance information, your primary doctor, any important specialists, and communication support needed. So if somebody needs to use a device to communicate, include that, because then if somebody's in the emergency room and the doctors are saying, well, this person is not verbal, well, maybe there's a way that they can communicate, and we need to express that. Like they said, your major health conditions, medications, allergies, and dietary restrictions. This is just a little bit of bigger piece of that picture. And then if you have an advance directive or a living will, a power of attorney, if there's a do not resuscitate order, or some other orders around the end of life, these are important to put. And then this is the blank one, but what I really love about this is it gives you an opportunity to put the picture of the individual, when they're well. So to kind of, emphasize that this is a person and what they prefer to be called, what people appreciate about me, what's important to me, and how to best support me. So this is where you could put in if there's certain sensory needs, certain assistant needs. This is important. So here's an example, this is from online, about an example of somebody named Brian Blake, contact information, including his psychiatrist, important health conditions, schizophrenia, diabetes, and needing glasses. So that would be important if you're saying, okay, the individual's not reading, well, why not? Maybe they're missing their glasses. And medications. And then this is the picture of the individual. So here's Mr. Blake. So you see him as a person who's well, and maybe not somebody who's sick in the hospital, and things that people appreciate about him, things that are important to him. And then this one really included something important about a prior loss of his son in a car accident, and that sometimes he hears his son's voices, and that this is comforting to him and nothing to worry about. So that's something really critical you would want a doctor to know who's maybe taking care of Mr. Blake. Let's say if there was a car accident and doesn't know the whole story about this individual, if there's a way to have this with the individual or get it to the doctors caring for him, it can be very, very helpful. And then how to best support him, keeping pain under control, reassuring him of safety. And this, even when Mr. Blake is struggling with psychiatric symptoms, he understands much of what is being said. So speak to him and explain what you're doing. And then some important snacks for his diabetes: almonds, yogurt, and apples. And this was filled out by his primary doctor. So this is something, again, I think it's really nice and something that you can think about doing for yourself or other people in your life. There is another one through Sick Kids, from Canada, a nice healthcare passport that lets you, this was a test one, but it lets you put a lot of information in about like activities of daily living. So what is this individual able to do? Or what do they need help with? Communication needs. So this, I was able to put the option that it can take a while to put my thoughts into words. Sometimes I have difficulty responding to people. It is easier for me to understand pictures, and I'm somewhat uncomfortable around people I don't know. So if I knew this as the doctor, then maybe I could help explain things with pictures rather than just talking on and on like I'm doing right now. So these are important things, and really some concerns that this individual is very afraid of needles or things touching them. So this is something you would want to know in the healthcare setting, and that they're in their own decision maker. And this, just to kind of let you all know things that are out there. There is some other, the Illinois Transition Project has a nice guide about finding adult providers. And it is something you can refer to later. Again, some of this is going to be specific to Illinois, but a lot of the concepts were what I discussed, that, you know, you can ask your current doctor for a referral. It's really a recommendation, because primary doctors don't usually refer to primary doctors, but they can certainly recommend. And thinking about who your parents see, because that might be a great option. Checking with your local support groups. Calling large medical and specialty rehab hospitals. That's a good tip also. So, you know, if you know that you may need specialty care at UCLA, for example, then calling them and seeing how that's going to work with primary doctors and insurance. So this is something else that's out there online and kind of goes through a checklist of questions. A lot of these I covered. Does the doctor accept your insurance? Are they taking new patients? Is the office accessible? What are the office hours? Is it close to your home? Lorena and I discussed this. That's another really important thing. Maybe the first thing to think, am I going to be able to get there easily? And how flexible are the hours? Will they allow a service dog or somebody else with you, make accommodations as needed? And is your doctor willing to discuss your health history and special needs with your pediatric doctor? That would be excellent. Do they see patients with similar health conditions to yours? But again, if they don't, and it's a good doctor you want to see, we want to empower them to learn. So again, these are some a nice little checklist you can refer to as well. So just so you know, again, if you're in the situation where you're having to remind a doctor or office that they need to be accessible and that there are things that they need to learn to take care of you, I just want to go through some of the resources that are out there. And these actually come from slides that I use when I teach doctors in training or physician assistants in training, to let them know that they need to see everybody when they become providers independently, and not turn people away because they don't know about their disability or say that they don't have the resources. They need to figure it out and make their care accessible. So this just reminds from the ADA, the American with Disabilities Act, and Section 504 of the Rehabilitation Act, that it requires doctors and other healthcare providers to ensure effective communication with patients with disabilities, so that you need to use aids or interpreter, etc., as needed. And so this is something that you need to keep in mind. And if your office is not, the office where you're going is not doing this, you need to remind them that it's a legal obligation. And then this is also available online, showing what an accessible exam room would look like. making sure that there's proper wheelchair access, and that the bed, like the height can be adjusted to accommodate the needs of an individual to be able to get on the bed and move, etc. So if you, again, find a place that is not following these accessibility guidelines, they can be found online and used to educate offices that are not in compliance. And I always teach, again, upcoming students about resources through the CDC, about person first language. So again, making sure they're speaking to individuals with respect, and focusing on the individual and not whatever medical condition or disability that they may have. The language should be focused on that person. The Vanderbilt Kennedy Center has some great communication tips as well. You know, some of these are simple, but sometimes doctors need to be reminded to speak to the patient directly, you know, explaining what they're going to be doing next. I'm going to listen to your heart. I'm going to lift up the back of your shirt to listen to your lungs, just being really respectful. Some of these are basics, but sometimes people need to be gently reminded. Again, using plain language and person-centered language as well, and listening. So again, there's some good resources through CDC, Disability and Health. AUCD has some great resources as well, and they have a public health is for everyone and lots of resources about making healthcare more accessible. There is a guideline from the American College of Gynecologists about serving women with disabilities, because sometimes there's issues with getting pap smears and mammograms because of the equipment. So they have a nice guideline here. Dr. Yin actually, with San Gabriel Pomona Regional Center, made a kind of guideline about screening. I mean, one of the things that we've run into with individuals with disabilities is not getting their basic primary care, basic cancer screening that everybody should be getting. So there's a guide, and it's on the AUCD website now, just reminding doctors that they need to go through the same screenings they go through with any patient, no matter what the individual's medical condition may imply. So these are suggested healthcare guidelines for adults with developmental disabilities, but really they're healthcare guidelines that apply to everyone. That's really the bottom line. And these guidelines use the U.S. Preventative Services Task Force guidelines, which do change. But this, you know, all the basic cancer screening, diabetes screening, cholesterol screening, this needs to apply to anybody. So that is out there. And then if the doctor says, hey, I don't know what your disease or your condition is, your disorder, it's all online. There's a great one, rarediseases.org. Really, we can all use Google, and then doctors usually know which are the good sources and not, and find information out. So that's the end of my slides, and then I'll look at the chat and take any live questions. But I wanted to thank Guadalupe Lorena Eaton, who helped me prepare this and make sure I was giving correct information, as well as Rowan Smith, who helped with the info and making the slides look nice, and Crystal Ash, who's been instrumental in preparing this whole summit today, and of course Cecily Betts, who's led this. So I'll stop sharing, and then that way I can see the chat. Ooh, Crystal put the resources. Thank you. And then PDF of slides and recording emailed to participants. I assume so, Crystal. And yeah, some of the links may not have worked on the slides, but Crystal put a bunch in the chat. Thank you. Okay, great. Does anybody have any questions they want to say live on Zoom? If not, that's completely okay. You can always follow up with email as well.
Doctor, I have a question.
Mm-hmm.
I love the passports, and I've been really researching because I think it's very important. We have, and our transition clinic, we have one that Dr. Weiner does that is very simple. It's just one page and everything. But
Mhm.
the other ones that you have are really, really well thought and described. My issue with that is culture, because we're talking about our cultures and everything. When we give the family a piece of paper, the family may have a ton of things to do. So you don't think, do you recommend us to sit with them before, like with a social work summit and work with them?
Yeah, I think that's important to consider, that not everybody's going to download it and just do it without any assistance. I mean, even as I was presenting, I was thinking this would be something really nice to sit down with the family and do. So I think it's you've got to kind of work with what resources you have. And I could make it would probably be a whole visit in clinic to do this with a family, but it's certainly possible. And then again, seeing what resources, if you have a navigator in your clinic, I would use them, or a community-based organization or another advocate that can help kind of prepare that, and another parent who can say, you know, this is information I want to make sure is there for my child, and then help that another parent kind of understand as well what might be important.
What will you do with families that don't read and write?
I would find a resource that, you know, somebody who would sit with them and do it with them.
Thank you, doctor.
Yeah. I see Sandra's hand up. Hi, Sandra.
Hi, sorry to pop in so late, trying to get my grades in. I just, I'm not sure if you covered this maybe before I popped in, but one of the problems that the parents I work with seem to have a lot of difficulty with is when they're at appointments with their loved ones, if that person is over 18, but is not able to make decisions on their own, and they are not conserved, there is sort of a difficulty between providers being willing to have conversations with parents or family members or whoever it is that accompanies that individual to their appointments. And I know we talk a lot about supported decision making in lieu of conservatorship. And now there's actually a law that says that we can use that. So that's a step in the right direction. But is there a recommendation that you have for families, especially families from like my culture, Latino culture, or other cultures where we find that in some Asian cultures, the male son, if the person is widowed, or you know, even if it's a child, the male father continues to make decisions for this individual into adulthood. So is there some way that can be communicated to providers up front so that it's not a complication when people are in the middle of trying to get something taken care of medically?
Yeah, absolutely. And we definitely run into that a lot. And I think it's important to have it in writing, and kind of go maybe the medical power of attorney route, or to at least, you know, have something in writing that this individual is to accompany you to help make medical decisions. Having that paperwork can be really helpful.
Okay, so it's something that the family should write up then?
Yeah.
Or is it a document that you as providers can give to the family for them to read, or have someone assist them with reading that document and signing it?
Yeah, I mean, I usually recommend power of attorney. I usually ask Lorena for help. She's saying both, because the doctor may not have. We actually talked about maybe having something to give families that then they can take the next step to filling out. Lorena, do you want to jump in?
Yes, it depends also on the clinic. Some clinics they do have a paper that the adult a patient has to sign before they actually be seen. There's other ones that they would not take. It depends actually on the doctor. Also, a lot of doctors would not take a power of attorney if they don't feel that the child has the mental capacity to understand the contract that he has signed. So it depends on, like I said, on the doctor and the clinic. But with a conservatorship is the law. So it's by a judge. So everybody has to consider that, but not everybody qualifies for a conservatorship.
What is the easiest resource you provide families with for power of attorney and getting that completed, not conservatorship?
One of the things that I do, we give we have it how to write a power of attorney. And we have it already in 3 languages. So we want to expand it to a more, for more languages. But one of the things that we do is just, telling them that it's just a paper that states that the adult needs help with this area, but also to put the limitations, especially if it's a female and she wants to have kids and the mom says, no, I don't want you to have kids. So we tell the child, we explain to the child when, if you want to not have, birth controls and everything, your mom cannot, obligate you to do that. You have that choice. So she can write that in that document stating that, okay, I give my mom permission to make the appointments, but not to make decisions about my fertility or about me doing this. And then this is only good for a period of time. If I see that it's not working, I can revoke it at any time. So it is important to let the consumer understand what his rights are. But it's just a simple, we always tell them, go to the internet, you can get a sample, just sign it, make sure it has 2 witnesses to it, and also to be notarized, to be more legal. In a lot of places that's work. But like I said, it depends actually on the clinic or the provider.
What they'll accept, yeah. And then I see a question in Spanish about that resource. So maybe that's something we can, what you mentioned, Lorena, that's in 3 languages, we can share after this. And then do you know of any kind of free legal advice related to this specifically, not conservatorship?
Bed sitters in Los Angeles, they do power of attorney. They do that. Also, I think it's the community legal community services in LA. They have one. The law library. I always emphasize that there's a lot of resources at the law library. We have a beautiful one here in LA, and usually on Fridays we have free lawyers that they can come and talk to you about this, any issues from housing, disabilities, educational, about anything. Power of attorney or conservatorship option is one of them, and they can literally sit down and write that with you right there. And it's free. So it is important just to look in your area to see what's available. But like the internet, we have a lot of the sample ones in the internet, and we always, getting them and making it tailoring to that specific, family or that specific adult need.
Okay, great. Okay.
All right. I want to
Thank you.
Thank you so much for your really informative presentation here, Dr. Mazayan, on, that really, tricky, problematic transfer of care. That is really a challenge, and how do you do it? And you really provided a really great roadmap to enable us listening to your presentation to have a much better idea of how to navigate that. So thank you so much.
You're welcome. Thank you for having me.
Yes,
And thank you for your help, Lorena.
Okay, of course. All right. Now we move into our consumer panel. And I'm always excited to help facilitate panels with individuals, adults who have that lived experience of what that is like in terms of accessing care on the adult side, or moving from pediatric to adult care. And so we have a really exceptional panel of consumers and self-advocates. And I'd like to introduce them to you. We have Kate Harwood, who's from Texas. And I keep forgetting when I'm setting up these meetings to say, this is California time. But anyhow, she's a LEN trainee at the Austin UT Stephen Hicks School of Social Work, Center for Disability Studies. And she's very involved in self-advocacy movement. And it's really terrific. She's going to be starting her doctoral studies in social work in the fall. It's wonderful. Another member of our panel is Maria Marquez, and I think you may have met Maria earlier when she was sharing some of her own lived experience. She's our self-advocate training coordinator in our California Leadership in Neurodevelopmental Related Disabilities Education, it's a mouthful, training program here at the UCEDD. Then another member of our panel is Alex Andy Fong, and he is referred to as Alex the Poet. And he is a prolific writer, having published hundreds of film review for Movie Boozer, contributed articles to Mindfray. And if you're so interested, you can go on to Amazon and purchase An Altruistic, which is a collection of his poems. And I can tell you, he's an exquisite poet. Then we also have Jonathan Valen, who is now a candidate at Cal State LA in rehabilitation counseling. And he works at Cal Life, and it's an acronym for Communities Actively Living Independent and Free, and that's an independent living center. And there, Johnny is a program advocate with the Aging Disability Research Connection Program. And finally, Wesley Witherspoon, who is our UCEDD self-advocate, and he leads that program here at our UCEDD, and he's currently chair of the California State Council on Developmental Disabilities. So this panel is going to be sharing perspectives about their transfer of care and accessing adult services. So as we were meeting and talking about what kinds of areas do they want to share with you, they came up with this sort of group of ideas, and they were preparing to become independent, meaning what can parents and caregivers do to help support their children, their sons and daughters, to make that transfer of care and to transition into adulthood. And looking for a provider, what was their experience and what suggestions would they offer to those attending this summit? And becoming their own healthcare self-advocate, what they learned. So without further ado, let's get started. And here are our panel members here. And is it possible that we can have a screen with just our panel members, or to show them more prominently? All right. We're getting there. So let me sort of ask the first question here. and ask, for any of you to sort of jump in right now and offer your perspectives in terms of tips for parents and caregivers, and frankly, for all of us, to help young people to become more independent and managing their own health care, or as much as they can. So who wants to jump in here first? All right, Wesley.
Okay, so my suggestion is getting your medical records. That's really important, because your medical records is your health, and just talk to all different specialties, talking different things, because you might have, for example, you might have a diagnosis, maybe a high blood pressure, you might have depression or something like that. You just know all the different specialties that you're working with, and also make sure you have your cards. Make sure you have your Medi-Cal card or your healthcare coverage card, and make sure you have your prescriptions and everything cleared, because you're gonna be working a lot of different agencies, and it's very important to have the information on yourself and be independent.
So Wesley, let me just ask you a follow-up here. Did you have to figure this out yourself, or did someone provide you with this advisement in terms of getting your medical records for your when you're moving to new providers?
So when I changed my provider, I had to get the information. They wanted my medical records, they wanted my everything, and I had to get the Medi-Cal card, and just know how to change providers and just have different information. And you could go online and do it, or you could have someone else help you. You can have your worker at the regional cell help you. You can have your IOS worker, SOS worker help you, or you can have a family member help you. That's my advice.
Okay, all right. Johnny, I see that. Go ahead.
Yeah, thank you. First of all, good morning, everyone. Thank you, Dr. Betts, for having us again. It's always great to be with these amazing people I've been able to meet. And yes, I think for me to, my advice is really helping the individuals, when they're in a transitional age, to better understand their medical history. A lot of times, whether it be with their, IEPs in school or their prescriptions, they're given the accommodations. They don't need to ask. They're given their medication. They don't need to ask, for it. And it really creates a barrier in understanding what they have, and knowledge is power. At the end of the day, knowledge is power, and the sooner we understand our disabilities, the sooner we're able to really gain our independence. We are the experts on our lives, but there is this whole, portion that at least in the Latino community is not discussed, or it's not, it's not recognized. And that is our disability.
Mhm. All right, a couple of things I do want to mention to those listening. When Johnny referred to having been on another panel, these same people were on a consumer panel, which was presented to the third year medical students at USC. And so they participated in that venue, and it was really well received. They really appreciated hearing directly from self-advocates and consumers. So I just put that context there. But Johnny, what you're saying is that it's really important that parents, caregivers, providers, that they explain and provide information about the medications that you are taking, that you are provided information about why you're getting certain treatments, or, you know, blood taken, or that it's just not done or just not given, but that you're taught.
Yeah, and that you give more emphasis. I think there is a lack of variety in when it comes to the disability community. People don't think that it should be celebrated as much as we celebrate other marginal groups, or or other cultures. And it's community. There is community, and there is having and knowing of the history, the community, and being proud of that aspect of your life as well.
Okay. Let me ask Alex the poet. Now he's having some computer difficulty, but he is on the phone. So Alex, what would you like to share about that? Tips for parents and caregivers and providers?
Oh, hi. What was the question again? I kind of just lost my train of thought because I was waiting for the other people.
That's all right. The question was, what suggestions do those of you on the panel have that would be helpful to enable sons, daughters, young people become more independent in taking care of themselves, and especially as it relates to, transferring your health care and, becoming an adult?
Oh, that's actually a very good question. So let me explain. The thing is that I'm an adult because I'm over 18. But the thing is that during my adulthood, I had to learn that in real life, you actually do need to behave yourself. And Jane Austen herself was famous for writing novels about the boundaries of propriety. So the truth is that contrary to popular belief, you really can't do whatever you want in life whenever you turn 18. So I would just say cope with reality and accept real life for what it is. And just as a source of inspiration, one time Audrey Hepburn, the actress, said that there's no such thing as impossible because the word impossible says I am possible, like I am. So that would be my advice. Thank you. So just chase after your dreams and never give up at all. Thank you.
Thank you, Alex. Thank you for that insight. I am possible. That's terrific. Thank you. Kate, how about you? What kind of,
Well, okay. So I was listening to Johnny's point about being your own expert, and then Wesley was talking a lot about records. I think, unfortunately, having a childhood onset condition, one thing that I've encountered a lot is having to get care from providers who have little to no experience with my condition in the adult world. And at first, that was really frustrating for me. Now I realize that that's the way it is. Sometimes I have to provide continuing education for them. And what matters most is that they're willing to listen and they have a willingness to help someone in a bit of a novel situation. And
I have an appointment next week. I have my medical power of attorney. I should print out, I have a pretty decent medical summary that if someone hasn't read my whole chart, they can flip through that pretty quickly and get a pretty good gist of what's going on for a procedure I need to go for several times a year. I have a list of tips that both help me and help the staff provide the best care for me. I also have a handout with more about me and a photo. So unfortunately, I've kind of learned that the hard way, but providing people with big print, one-sided or two-sided things with a photo and some reference materials, I mean, it really helps make appointments go a lot better. I mean, like I said, I've learned that the hard way through actually some unfortunate circumstances, but hey, we got there. So
what you have done is you've organized a number of documents that you take with you for each and every visit that you have.
yeah.
Can I ask you to share some of those tips on your sheet that you give to providers?
Like, okay, okay, some tips. Okay, it even says on the tip sheet, read my chart and understand my complex medical situation better. You would laugh, but
No, I'm not laughing. I think that's just such a great tip.
okay, not making negative comments about my body. I have been judged a lot. Taking extra time with me, when possible. I don't want to give away too much, but establishing some sort of the relationship before treating me. Sometimes new people in this situation can be a trigger. If we can meet and talk on the phone or drop by briefly, that increases my comfort. It's that kind of stuff.
Yeah, that's really helpful. And Kate, can I ask you, how did you come about to take charge in that regard? Did someone provide you with some guidance, some assistance? Was it your parents? Was it some other provider? Just how did
some of the providers started making comments like, hey, if I had this information in a concise place, this would help.
Okay.
And then for a particular procedure I have to go through a lot, one of my providers started doing a social story and we started writing that down. And then I realized, hey, to give this to the person beforehand, like who's doing the procedure, it's not only helpful for me, but it's also helpful for them.
Yeah.
So it kind of just over the past couple of years, this kind of just, and then I saw, I don't know her. I want to get her name. She works at the UCEDD in the land at UT Austin. She's a mom of a child with a complex genetic disorder. I think her name is Laura, and I can get her last name, but she also gave a talk about how she and her family have a similar sheet with a picture of her son and like pretty much the exact same things that help.
Yeah.
Kind of verbiage. So I also saw that talk. So it was just kind of a combination of different providers giving me feedback. One of my providers starting to write this up anyway, and then seeing that talk. So it just kind of collided, but I wish I had it earlier. Like I said, it's a bit of
annoying because it puts a lot on me too, but I've just come to accept that if I want the best care possible, sometimes we have to provide people with more information, especially if they're not really familiar with people with similar conditions or childhood onset stuff, and their base of understanding might be
Right.
this might be more novel. So I mean, I have no problem educating people who are willing to learn, and or if we're just trying to help each other, I'm trying to make their job as easy so this goes as smoothly as possible with minimal road bumps, and then I have a better experience. I mean, it's a win-win for everybody.
Yes, absolutely. And you offered some really relevant, useful, great ideas for taking charge of your situation when you encounter healthcare professionals. And you provide some really good tips here, really good tips.
Thank
and
you.
tips to help parents, caregivers to help facilitate that for their son or daughter.
Yeah. And then on the one sheet on the back, I just explain about my service dog and what her name is and what her job is, and that I have a degree in social work and some of my hobbies and a picture of me. So like human perspective too, I guess, can help.
Yeah, yeah. All right. Great. Great. Maria,
Yeah, can you hear me?
I'll circle back with you, Johnny. We'll let Maria share some like tips for parents, caregivers.
Actually, Cecily, I did something similar to Kate when I had a really bad fall and I broke my whole rotating cuff, and that was a big challenge for me because I didn't walk for a whole year. So I was bedridden because the doctor didn't want me to move my shoulder at all so it could heal correctly. So every time I went to the doctor, I took down notes on my medication, on how it affected me or how it didn't affect me. I took down notes on what exercise I was doing, because I still had to keep my body going even though I was bedridden. And so we got to the point that when I would go to my doctor's appointment, he would tell me, let me look at your notes, because he knew I had everything down. And he really liked that. And it's not like he would run in and out. He would go through each thing, each item that I wrote, if it was working or not working, and he just loved it. He goes, I love you. He goes, you come in with your notes and you're telling me what you need and what you don't need. He goes, this is really great.
It's wonderful.
And that's the first time I ever did that, because I thought about it and I go, well, okay, I'm doing more sit-ups, I'm doing more this, I can bend my leg more, I could stand up with assistance, and it took me a long time to recuperate from that fall, because he didn't want me to move my shoulder at all, because he wanted it to get healed correctly so that I could use my walker and I could drive again and do everything I was doing like I did before. But I was very depressed and I never realized it until my family told me, you're not as happy as you used to be. I go, well, I'm just home. But I had several nurses that would be coming in and out of my house. But one company, I had to stop them because they would just send somebody randomly without letting me know. Because I had my nurses already in place, but then they wouldn't call me and let me know, oh, so-and-so's out. They would just send somebody. And I felt very uncomfortable with random people being in my house.
Yeah.
So I put a stop to that.
Wow.
And then Regional Center helped me through, with some of my stuff, but it took a long time of healing, and actually it even took me a long time to get back into the self-advocacy movement, because I was out for a couple of years, I guess, because I didn't realize how much of a depression I was in. And then I got back on the saddle and here I am again.
Great, great. Well, I think building upon what Kate and Johnny and Wesley were all saying, and Alex as well, is that you were taking charge in that you were documenting your own progress,
Yes.
seeing how you were moving along, sharing that with your provider, which really your provider really appreciated because he could see then in documented progress or issues that you had. So you really helped to facilitate then the kind of care that you needed to receive in order to progress forward. But nevertheless, you were also, you experienced depression as, I mean, being restricted so much as you
Yes.
were would be very challenging indeed. Indeed.
And then what he did also is that when I had my last appointment with that doctor, it was through Ken Medical. He said, and I had Kaiser insurance, so, and I still have it now. What he did was refer me to the doctor that he showed him how to do the surgery that he did on me.
Oh,
So that doctor, I forgot his name. He knew about my case even before I went to him.
oh, okay.
Yeah,
Okay,
because
so,
he's the one that taught him the same surgery that he did on me, how to do that surgery. So
okay,
he got a really good understanding of my case.
yeah, yeah. All right. So it really sort of dissipated or went to other providers as well to help
Yeah.
them. So let's circle back because Johnny wanted to make a comment in response to what Kate was saying, and perhaps somebody else in the group.
Yeah, I was just going to, clean up the bike, but I like that it makes it also personal. It's not just your medical history, but your social history, what you like in it. It really gives a personality to the patient. So I think that's awesome.
So it's not only communicating to your provider, your healthcare provider, what your healthcare needs are about, but who you are, your interests, needs, and preferences that are very individual to you. That's an important piece as well. There's some comment here in the chats that I want to just call to your attention. And Ivy Goldstein said, really loved your comment and advocacy about telling providers up front not to make negative comments. We know the biases are real. So that was a favorable and important response to what you had to say. And Wesley said, it's important to do your own research in terms of becoming independent and listening to peers. So Wesley, can I ask you about your comment, listening to peers? Can you expand on that a little?
Yes. So when I say listen to peers, I just listen to people that are in similar situations because everybody's situation is different.
Yeah.
Like I had my best friend, he lost his battle to cancer last year, and the care he had was, according to his caregiver, said it wasn't that good. So I just encourage people to do their research about the conditions, and sometimes you have to do second opinions and go to different providers because one provider may not work for everybody. Everybody have different conditions, so what worked for one person may not work for another person. And just do your own research on about how to get best world-class care, because if you don't, no one else does it. So either have your regional center help you out with that, or your family help you with that, or you do it yourself, or your provider, and just do the research because these are the best world-class care as possible.
So your important point here is not to just say, all right, this is the doctor, or this is the provider I have. I'm not happy or satisfied with the kind of care I'm receiving, and you shouldn't just say that's okay. That you need to, or you should, or you have every right to say, I need to have another provider. I need to find someone who will provide the kind of care that I feel I need.
Yes, that's what I'm saying. Sometimes you have to go to a different provider and ask other people and do your own research and just try to get the best world-class care possible. And that's really important because it's a matter of life and death.
Very good point made, Wesley. Very good point.
Cicely, could I also add, when I broke, let's see what I did. I broke where my elbow was. I mean, it's not shattered or anything, but I had surgery for that. And the regional center kept sending me people, right, to help me. And some of them were like on left field instead of being on my same page, where I got to the point where I said, you need to leave my house. I go, because you're just sitting there watching TV. And I'm asking you to help me with stuff, and you're just sitting there.
Good for
And
you. Good
you know,
for
and, and that was that I spoke up for myself. And then they thought I was crazy, that the regional center thought I was crazy. And so they sent one of the directors from the program that sent people, and she really evaluated, you know, my living and everything. And then she realized that I was just really speaking up for myself.
Yeah, yeah. Very interesting situation. Very interesting. But
yes,
but it was how, I mean, you got what you needed to get, right?
Right.
Okay, so there's a question here, and actually it really fits well in now talking about looking for a provider and what your experiences have been and what suggestions you would offer. So here's the question, and I'll read it. I have a question for any of you. And again, this is from Ivy Goldstein. Has there been a time, maybe when you were earlier on in transitioning, where you found yourself in both the pediatric and adult world? Not all young adults with disabilities can find adult providers. I'm particularly curious if you had any encounters in an adult hospital, but your specialist was in pediatrics and wasn't part of your care. This has come up for our families. If so, what can help this situation to improve patient care? Any thoughts? Any comments you want to make to this question that Ivy had? All right, Wesley.
So I had a situation when I was in my first year of college and I had chicken pox, and they took me to Kaiser, and Kaiser just told me just put Caroline lotion on my chicken pox, and it was very, very much services. So you just have to go to things. You have to know about all these different diagnoses. Like there's always different diagnoses for now. People come out of COVID-19, and there's long-term COVID, and as a thing to consider as well. And just do your research, just talk to professionals. Sometimes you might get the best care at a certain place. You might have to go somewhere else. And when I was younger, after I was 19, my parents spoke to me. Now I speak for myself when I do my own care. I do my own research, and I talk to my peers. I talk to Rita Sarah. I do my own research as well. Just make sure I get the best care, and talk to providers, make sure we get a second opinion, and just do the research, see if they're a good provider or not, because what worked for one person may not work for someone else. So you just have to keep that in mind. Yeah. And that's all I gotta say.
Okay. Someone else want to jump in here? Have you been in that situation where you're in adult care, but you still have specialists in pediatric care, or you're having trouble finding the specialist that you had that you were accustomed to receiving pediatric care, but you're having challenges in adult care. All right, Maria.
Yes, that happened to me. They switched my doctor and I kept telling him what I was allergic to. And he gave me, and I had a really bad cough, and he gave me cough syrup. And I got hives all over my body. And I told him beforehand, I'm allergic to cough syrup, but he didn't listen to me. And he gave it to me. And my mom didn't read the bottle, right? Or I didn't, assuming that the doctor gave us the right medicine, and I just broke out in hives all over my body. That when I went to the emergency room, the doctor in the emergency room called up that doctor and said, "What are you doing? She's allergic." She had a really bad allergic reaction.
So was this in pediatric care or in adult care?
It was well, I was like 14 at the time.
Okay, so it was,
So I was like middle pediatric,
yeah,
but not an adult yet.
yeah. So, and were there records to say you had this allergy to this medication?
Yes, because Kaiser had them. Because my doctors knew I get pretty allergic to certain medicine.
Okay, all right.
But my mom had transitioned to another health care plan at that time, and that doctor didn't know what he was doing.
Okay, so there was a problem in that you were accessing a new provider who was not aware of your medical history.
Yes.
My goodness. Okay. Kate, did you want to say
Yeah, I
something?
mean, it's a hard situation. When I was a teen and a child, a lot of my care was centralized. There was pretty much 2 medical records, one in my suburban neighborhood, and then one when I would have to go to New York City for some specialty care. Now, I mean, I've had to go to different specialists and different doctors across like 4 medical systems. The chart isn't really super centralized. I don't really know what I can do to make it more centralized. I would say the godsend is finding people who see adults and kids if possible. They're too far and few between, but there are med peds people and there are family practice people, and there are not enough of them, but there are people who do see across the lifespan, and that can be a huge bridge. And that's honestly why I've been able to transition out of pediatric care, because I have access to some of that. And then the other thing is, I mean, just keeping papers and having a lot of papers on you, it's a pain, or logging into portals from other doctors' offices showing them things. But then ultimately, I mean, I'm lucky in that a lot of my providers are willing to pick up the phone and talk to another one of my provider. And honestly, that's been the saving grace on numerous occasions, just like a warm handoff or just their willingness. And now there are some, like one of my doctors was telling me that he gets reimbursed for talking with my other providers. There are some brand new CPT codes for this kind of stuff. But those phone calls, I mean, because even sometimes people don't believe you know what you're saying, even when you do, which is unfortunate. So sometimes it needs to be like doctor to doctor.
Okay, so you have brought up a whole lot of different.
I mean, if you want to know.
No, but this is a reality. And the reality is that you see specialists in they're not in one setting. So that's a challenge. And because of that, then communication between providers is a challenge. And that they don't see you as a reliable historian.
even though it's ridiculous because sometimes I'm not even trying to be a historian. I bring a record from another doctor or something. I bring a report and they still don't believe it.
Oh, goodness. Wow. All right. So yeah, I want to ask Johnny to jump in here because you had said something that I thought was really important and relevant in another situation where you would have visits with your mother accompanied you in the past, and how you had to advise the physician or other provider in terms of communication style.
Yeah, and this is the fact that I have to ingrain in my mom for any request that whenever people ask her questions to just about me to just not answer. There's been occasions where I don't wanna condone any type of behavior, but there are, situations where one must get carded when buying a product. Um, and, they will look at my mom and be like, is he over 21? And I'm like, well, I'm buying it. You should ask me if I'm over 21. Situations like that. And then I tell my mom, like, don't answer. Don't answer until they ask me. I do this with my daughter as well. They tend to just direct themselves to the adult or the caretaker. And not really hear me out. And even, sometimes they'll ask, like, what do you think? And I'll answer, what are his symptoms? And I'll answer, and they still, I guess not consciously, but they still direct themselves. They're not answering, and they're understanding because they're writing it down. They keep directing themselves to my parents. So, and sometimes I need my parents going with me because, if I am having a flu symptom or something, I am a bit weaker. So sometimes my speech would get a bit more slur. But I feel like I should be the one to make that choice whether my parents can answer or not. Or I guess just, have myself answer and then have my parents, reiterate my concern, my opinion. Did I answer the question?
Yeah, you more than answered the question.
Like, what did I do? Okay.
No, but the whole point here is that regardless, if you're having a visit with your provider and you may be accompanied by someone else, you are the patient. And therefore, you're the person that needs to answer the questions, but to have the provider communicate with you directly and not to the other person in the room. And that's, you want to be respected.
Yeah, respect, yes.
Yeah, yeah. So
Hi,
Wesley,
could I chime in?
yes, Alex, please do.
Oh, yes, I was just waiting for the other people. Thank you for appreciating my patience. But the thing is that this question doesn't really apply to me because I don't have to deal with providers or stuff like that. But I will offer this piece of advice. The thing is that don't judge a book by its cover applies to actually people and not just novels. Because a good example is Les Miserables by Victor Hugo. It implies that it's about miserable people, but it's really an epic masterpiece. And I will admit that when it comes to not judging people based on their covers, so to speak, the thing is that good providers would never harass you or use you, because I will admit that I met inappropriate women who made fun of me for being a guy, and of course that's just rude. So the thing is that if you do have a provider who doesn't treat you with respect, then just terminate the relationship, because if you interact with a crazy person, they'll just make your life miserable. That's all I have to say.
Thank you, Alex. Thank you for that comment. And your comment actually echoes what everyone else on this panel has said as well. So there's really consensus here that, you know, you have the right to access care from a provider who is respectful, knowledgeable, and, you know, treat you as the focus, the individual that they're here to treat. So Wesley, you've had your hand up, and you've also.
Okay. I would say a good doctor, for example, when my dad had a heart attack, the doctor actually told me to take some, what is it? Take some statins and take some things for my heart, because I have heart disease in my family. So a good doctor would just make good recommendations. And we go to a doctor, urgent care, emergency room. Yeah, they do triage, they check your vitals, they check what's going on, and it's according to how severe your case is. So sometimes you might we can see it right away. Sometimes it might take a long time. It depends. You have to call when you go to urgent care and stuff like that. Make sure to know how much time it's going to take, because it might be waiting there for a long time. Sometimes it can take as few as 20 minutes. Sometimes it might take 4 or 5 hours. So I put in the chat that one time I had a really bad cold. I had to get antibiotics, and I went to the hospital, and I stayed there for 4 hours. They never saw me. Then I went to a clinic, and they saw me within like 2 hours. So
Wow.
you have to call around before you go to your medical appointments, because it'll save you a lot of time. And that's my point.
Yeah, and a good point. That is that even when you're accessing urgent care or some other clinic in the community, to be aware of like what the wait times are. And it's sort of akin to what we've been talking about in terms of providers, those that will work with you and that you don't encounter these challenges. So, all right, we have just 5 minutes left. We've had such a good discussion here, and I can tell by in the chat, the audience has appreciated your comments as well. And I do want to say that Dr. Aldana said, Alex, in response to your comment, I love that book. Great example, Alex. So there you go. Just want to make sure that you are aware of that comment from Dr. Aldana. All right. Are there any last comments that any of you want to make, or perhaps there's some, I don't see any other questions in the chat as yet. So who wants to jump in here and have some final words? Wesley, is your hand still up, or is that from before?
But I could say something.
Go ahead.
Before the pandemic, doctors were really discouraged. They really discouraged people getting Medi-Cal. They say if you have Medi-Cal, they went a lot of providers wouldn't take it. So that's the reality. But I'm not sure what it's like now, because I haven't been to the doctor very much since COVID.
So you are bringing up a very pertinent challenge, and that is the difficulty of finding doctors depending on your health insurance plan. And unfortunately, there's no easy answer to that. Unless again, and Dr. Muzayan had provided a number of really good suggestions in that regard in terms of trying to find providers, but that is a challenge. That is certainly a challenge. Anyone else here? Yes,
Yeah,
Maria.
could I say something on that? With doctors and COVID and stuff. When you find a good doctor and you feel comfortable with that doctor, when you're an adult, you know, really, really keep in contact with that doctor, because it's hard to find a good doctor that would really listen to you, because some of them just run in and out. But because I observed them myself. But if they sit there and they take the time and they talk to you and they look at all your notes as they're checking you, then you know that they're a good doctor. But if they run in and out and they really don't listen to your opinion because they think, oh, she's disabled or he's disabled, they don't know, you know. But we do know, and we could feel it and sense it, you know, if they're gonna help us or not. And I think that they discriminate too against people with disabilities. You know, but the doctor that I have right now, I've had her for 12 years, so she already knows me, you know, when it comes to like, if I need to get a pap smear, if I need to get my lab test done, right away they'll text me and they'll send me like a little card. And I like that because then it's little reminders so that I don't forget. Because, you know, sometimes us in the everyday world, and we're trying to help everybody else, but sometimes we don't help ourselves. And so I like those little reminders, you know, so that I have to remember to take care of myself as well.
So Maria, you just offered another very important, relevant piece of for consideration when you're finding a provider, that they demonstrate genuine interest in you as a person, and that they're respectful of you as a person, and that they listen to you, which has been what each one of you has said throughout this panel presentation in various ways or another. So, and I think on that note, we're at the end of our time. I want to thank you all again for your insights, your knowledge, your expertise. It's been just, again, another very informative, helpful panel that you have shared your experience with the rest of us in terms of what is needed, what are the challenges. And so thank you. So what I want to say now is that we're going to break for lunch. We're going to break until 12:40, and then we have 2 more presentations. I will be talking immediately after lunch about health-related accommodations, which, you know, a lot of people don't really think about. These sound sort of strange. And then we have an important presentation on services, the issues related to undocumented individuals. So I thank you all for your very wonderful comments in the chat, and we'll see each other in about 40 minutes. Thank you. Have a good lunch. So I hope you all had a great lunch and you're ready to listen to a couple more presentations this afternoon. So one of the things that as I've been working in this field that I found really interesting was when we talk about health, sometimes we relegate this whole idea of health, disabilities to just this very narrow segment of the lived experience. And as was actually said earlier by Lorena, that families, consumers, self-advocates, they all need and ask for information about other services and other referrals as it relates to additional education once you have finished high school, or training program, or employment. And what is really interesting is that when with living with a disability, there are need at times for health-related accommodations to enable that experience to be optimized. So what I'm going to be talking about is that very thing for those who transition into adulthood. And what we have found is that information that's shared about post-secondary resources is not always consistently provided. Find many times that young people wanting to enroll in college or a training program don't hear about services that I'll be talking about, like disabled student services. They don't hear about Department of Rehab and their job training program or workability program. What comes up a lot is that they don't know how to interview for a job and what their rights and protections are. So we'll talk about that for next period of time. And so when we look at that, and let me get the slide. So future planning, and again, getting started, talking about what is it that you like to do, or what have you managed that you want to do, or getting someone gives you, or people give you feedback about particular skills or gifts or talents that you have, what works with what you can do, what you've learned in the past that you can take with you in the future. Like our panel of parents, our panel of consumers, they shared with all of us skills and knowledge that they've acquired based on what they learned in various situations. And the extent to which services and supports have been accessed. And again, what we learned earlier this morning, perhaps for some communities, asking for services and supports that is not part of the culture. So future planning is so influenced by so many different factors. So when we're talking about health and a person with a disability, we're talking about health. So no single measure is an accurate assessment of what a person can do work-wise. It's based upon health history and clinical needs. And I think earlier, Maria was talking about, for example, having had a major surgery and that she was laid up for a prolonged period of time. And that certainly would then impact her most immediate planning needs. But Maria has gone on and she's now a faculty member at the UCEDD. She was formerly chair of California State Council on Developmental Disabilities. So you know, there are periods perhaps where one is not able to be as engaged in employment, community living activities because of a major health crisis situation. And then what are the effects of the condition on functional abilities, meaning that, you know, someone having to use a wheelchair, somebody that is what we would say non-ambulatory, or having other health limitations that affects their sort of way in the world. So when we're talking about a job, and this is so interesting because there are young people who have these really hopeful ideas about what they want to do, but realistically, is it an appropriate job choice? So when thinking about employment and job, and this is like, especially those of us in healthcare, you know, we're there to advise and advise on situations beyond just the most immediate medical healthcare need. Like, is excessive standing going to cause skin breakdown? Or lifting heavy items causing back strain? Or maybe a person wants to do a particular job and they can do all the individual steps of the job, but to do them one after another may be a problem. Or, you know, thinking about the extent to which someone can independently engage in activities of daily living, or other what we call instrumental activities like making meals. So those are all factors to think about when getting a job. And I will say we had one young woman, this was in the spina bifida clinic, and she really wanted to be a hairstylist. And she was really enthused about it, but it proved to be a real difficult challenge because she wore braces and she was standing for prolonged periods of time, and she developed open wounds on her feet. So, you know, those kinds of future planning, we have important roles in that. And here's a model that the World Health Organization, and it's really useful for us to think about this, that whatever that person's disability is, and looking at what the body functions and structures are, what activities that person can engage in, the extent to which they can participate, are all influenced by the environment and their own personal factors. So, you know, it is a very inclusive, comprehensive look at what does this lived experience mean. And so also thinking about too, future planning. You know, there are all these considerations in terms of the individual's health condition, physical and mental limitations, was their age, was their gender, race and ethnicity, and we've heard comments related to those issues this morning. What are the challenges and what are the facilitators? And again, we heard about that what kind of social support does the individual have? Are they uplifted? Are they encouraged? Or are there some protective factors in place that may create some barriers, imaginary or real? What are the resources in the community? And again, we heard about some limitations that culturally might be in place in terms of accessing community resources, but also it depends where you live. And then do you live in an area where there are resources that you can access versus living in a more remote area where there aren't as many resources? What is your employer like? And what kind of assistance is available? Importantly, what kind of workplace accommodations? And then in terms of the employment situation itself, the tasks that the person's able to engage in, what kind of support is there in this environment, and leading to hopefully a successful employment situation experience. So there are a number of very helpful resources out there that we all can access to better create more positive employment situations, opportunities. And one is the Job Accommodation Network. That's a website for everyone, for families, for consumers, for providers, where they provide just a range of information on questions, issues that a person may have when they're thinking about wanting to get a job. And now this is so interesting. And it has occurred repeatedly with the young people that I've worked with, that they've said, well, Dr. Betts, I went in and I told them that I needed time for catheterization, that I needed break time, that I had to have time off for doctor's visits, da, 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 da. And this was all they said during the job interview. And I said, shh, you don't tell them anything about your need for accommodations during a job interview. You and some of them said, you just keep your mouth shut. Don't say anything. You're there to apply for a job. So an employer, and this was like a big revelation, really said, yes, don't say anything. You're there to apply for a job. You're not there to be quizzed about your disability. And so then we go through whole 9 yards about applying for a job, and that an employer cannot ask these questions. And this is not widely known, that they have rights and protections. And partly because this is a new environment, a new situation. So an employer not asking any disability questions, and particularly not any questions about the person, the young person's disability. And this sounds sort of extreme, but it does happen that a medical exam would be requested so that they are protected. And we do advise our young people that an employer has every right to interview you in terms of your skill and aptitude for a job, and asking the young person or adult, how do you think you would handle this situation? All employment related. And again, not any questions about the disability. And again, this is not well known amongst the young people that we work with. So we work hard on advising them in terms of future planning in these situations. And so what kind of accommodations might they need in a new employment situation? And this is not revealed until the person has been hired. But, the workstation modifications, scheduling changes, perhaps they need storage space for medical supplies. And so what is really sort of neat about this website is that, and especially for consumers and self-advocates and family members, to understand the range of accommodations that they would be eligible for in a work situation. So the Job Accommodation Network provides all kinds of examples by disability type. For example, accommodations for individual with intellectual disability, and they have these like myriads of, you know, what might be the limitation for the young person in a work situation. And here is a list, for example, when you're talking about limitations in cognitive functioning and all the suggestions there that perhaps the consumer, the family member, may not even think about that would be available, but to know, to understand what it is that they need. And our consumer panel earlier talked about, you know, learning what you need, that this is an issue of self-advocacy. And again, we find repeatedly that the whole issue of accommodations, especially when you're talking about outside of the secondary setting, that means elementary school, middle school, high school, that accommodations becomes a different issue in adult settings. So it really is relevant for providers to be knowledgeable, to advise young people, parents about the resources out there so that they can be effective self-advocates. And so this, you know, it's the whole idea that you don't only talk about health in a health situation, that you're talking about health related needs in employment situations as well. And again, all kinds of accommodations are listed on this website. So I encourage all of you to access it. They have just really helpful suggestions for people with cerebral palsy, people with seizure disorder, epilepsy. And so the accommodation process, and again, as working in healthcare, these are the kinds of strategies, advisement, counseling that we as providers should be knowledgeable in terms of advising young people, because they won't always get it in the school setting that they're in. It's variable, it's different. Some schools are really terrific and the counselors provide fantastic amounts of information about what a young person will need to know in a future employment settings. Others don't receive this information. So as healthcare providers, as self-advocates, as family members, knowing, for example, what the process is beforehand, and what the rights and protections are is really important. So first of all, to know that, all right, the person is hired into the job. So the process of then requesting, you've been hired because you have this set of knowledge and job skills, then what are the accommodations that are needed? And it's confidential. This is an issue that is talked with human resources. This information is not in the personnel file, and co-workers are not ever told about what accommodations the individual requires. And should there be a change needed, they're not told of the change, only told of the change, but not the reason for it. So it's very confidential in terms of acknowledging this person's rights and protections in an employment situation. And again, very important. And the process for obtaining accommodation is that once you're hired, you inform that employer, I need an accommodation. And then working out what that accommodation needs. Now, this is really, and it came up earlier, that sometimes information is not shared. But if information isn't shared, the person can be disadvantaged. And so the employer is only required to provide accommodations that they've been informed about. So it's really important, in order to be successful in a work setting, that the employer knows what accommodations are needed. And again, during this accommodation process, it may be that the worker may have to provide documentation, and that the accommodation that is provided really does work. It is helpful and supports the person in the job. And if not, then another approach is needed. And it's up to the employer to track whether that accommodation is working. So let's shift over, talk about, that's an employment setting. So let's talk about college resources and disabled student services. And again, not all young people have access to the supports in like a high school setting or some other setting where they even know about disabled student services that are available. And so it's really relevant and important to review with them, first of all, what is available in a college setting. So talk about the process of registering, exploring the services and supports available to register, and they will need proof of a disability. So that's where they get it from, either the pediatrician, their family physician, family practice physician, or their med-peds physician, or, if they're in an adult setting, from the adult provider. And very important to know what kind of documentation is needed. And usually there's a grace period of 6 months before you have to turn over the required documentation. And what is most helpful is with young people to go onto the websites, browse it, review it, because they all are different. Some schools are college settings are much better than others. They offer more diverse array of accommodations, and we'll go through those in a minute. Cal State University Northridge, they have a very large population of students with disabilities, primarily students who are deaf and hearing impaired. California State University Los Angeles has a very active office for students with disabilities. We've had several young people go there and have gotten really helpful accommodations that have helped them to be successful and progress through their college program. LA Trade Tech that's their disabled student program and services. And again, we have had good reports from students who've gone there that they've received helpful supports. You notice that I give you the websites of the programs that we've had good feedback from. And LA City College and Office of Special Services. So every one of these websites that I've shown you, the title of the service is slightly different. So when you see special services, disabled services, that's where you go. And what we suggest is that knowing what kinds of services are available through the college setting is almost as important as deciding where you're going to go for, academic reasons, for career reasons. If you have a disabled student service office that is not helpful, that's could possibly affect your college experience or your training experience. So it's really relevant to know the extent to which you're going to get services. So important to remember, IEP services and supports do not apply to college. 504 plans, and again, they're not necessarily all transferable to a college setting, but if you have a 504 plan, you can bring it with you, review it with Disabled Student Services, and go from there. So it's 504 plans in a college setting, no IEPs. They're a different set of services and supports.
Hi, this is Trina. Sorry.
Okay.
This is Trina. I'm sorry. You caught me in mid-thought and I was like, okay, I need to pick up the phone. That's Rose.
Can I ask somebody?
The phone says Maria and I'm like trying to process.
Could I ask someone to mute themselves? Okay. So, as I mentioned, they're not all the same. And in today's environment, taking a screenshot is really helpful, or the QR code up there, you can get that. And
I have to communicate with her because
somebody, could you please mute yourself? We can hear you. Thank you. And really making a visit to Disabled Student Services as part of sort of checking out the college settings is really a good idea. And, again, meeting with them, setting up the appointment, reviewing with them what your needs are and what is available and what are the next steps. So here are some of the accommodations that are available. Test accommodations in different formats, getting extra time, perhaps taking a test in the Disabled Student Services office, quiet space. This all has to be worked out with the faculty member before class is started. Disabled parking on campus, transit service. We had one young person who said, well, I would like to go there. And it was actually, I believe it was Glendale Community College. And they said, but it's hilly and I can't get around. And I said, no, you're in luck. They have transit service. And this is how, you talk to them about, and they pick you up, take you to the next class, etc. So again, really important to be informed about these resources. And then talking about, having materials in accessible format, alternative ways to obtain credit, disability counseling, alternative media for reading. And again, some schools are much better than others. And note takers. Now there's a magic pen And I know one community college offered a magic pen. I said, what is a magic pen? And a magic pen is that this pen records what is being said in class as you're taking notes. It's really sort of a nifty device. Now, not all colleges have that. They may encourage a faculty member to provide their PowerPoint. We've had students had that, or have another student share their notes. That's really sort of a variable option, and not really, depends on the other student. Is other student taking notes? It's also sort of a privacy issue, or taping the class. And then assistive technology varies. Some schools, they'll have tutors to assist with, courses that are particularly challenging. And importantly is to talk about the financial aid available. So the first step is going to the FAFSA, the Free Application for Federal Student Aid, FAFSA. And it's sort of the go-to site that is used by government agencies, universities, private foundations for determining whether the student is eligible for student aid. And the type of aid provided: loans, grants, scholarships, and federal work-study programs. And again, these are all the array of programs. Now, for those of us providing services, don't have to drill down to the most minute detail, but at least to know where to guide the young person, the adult, to these resources. And here's the website homepage. And there's different kinds of grants. Like the Pell Grant is an ideal one, there's no payback. And this year, they award up to $6,395 to assist with tuition. It's based on need, based on degree type, your academic performance. And again, you apply through the website. There's Teach Grant for those students who want to become teachers. And, the tuition is paid for. And if you commit to teaching full-time for 4 years in an area of high need, low income, secondary school, educational agency, you'll have your tuition reimbursed. And there's student loans. Federal loans are much better than private loans. They have lower rates of interest. And, for students with disabilities, actually in California, and I talk to them a lot about the workability program, that students with disabilities are eligible for these programs, and they receive, working with the rehab counselor, they go to a publicly financed training program, community college, state university. They can be eligible to receive tuition support, funding for their books, their supplies. And I asked one of our young people who went to a local community college, I said, now, how does that work? Tell me. He says, well, you access the bookstore website, I get the books, I enter the code, and the books get delivered the next week. I said, wow, that's pretty good. Very nice. So these programs really are helpful. And especially, we will be talking to parents of children who are, they're middle school. We say, in the future, your son and daughter may be eligible for these programs, college tuition, because that's an area of concern for parents in terms of the affordability. And I can't tell you the number of times we feel so relieved hearing about those options for their sons and daughters. And then federal work study programs that they can earn money by having part-time jobs as a research assistant, teaching assistant. And then, of course, talking about independent living centers for independent living centers. And again, making referrals and talking about what's available there. And here's a map of all the independent living centers. And in LA County, there are 7. Now you met earlier Johnny, who works at Cal Life, an independent living center. And they're fantastic. For example, at Cal Life, they can be helpful with immediate Section 8 housing. Now that housing or those is available downtown LA. But for those of you familiar with Section 8 housing, there can be waiting lists that are years long. So accessing independent living centers can be enormously helpful. They have peer mentoring. They can help with durable medical supplies, equipment. So this is a resource that frankly is not, it is underutilized by our community. It certainly is a resource that can be really valuable. And here are the core services, helping with independent living skills, as I mentioned, housing, peer counseling, also with personal assistant services and assistive technology, all array of services. And then the regional occupational programs. And for those students who want to learn a trade, these programs are for high school students and adults. And again, thinking about what works in terms of future planning. And like, here's one program in Southern California. I'll show you the website there. And these are the kinds of programs that are available. Like, there's a lot of young people that I deal with who love animals. So pet health and grooming, veterinary programs as a vet assistant, medical assistant, cosmetology. One of our young people was in a welding program at LA Trade Tech. So there's just an HVAC program, is heating, ventilation, air conditioning program. And again, one of our young people went into that program and really enjoyed it. And of course, gaming is very popular amongst young people today. Here's a website. And again, very helpful. Another training option. And then talking about, applying to Department of Rehabilitation for job training, job placement. And as I mentioned, workability program. And I just copied this front page, pretty easy in terms of accessing. And once you apply within up to may take 3 months, but generally not that long to get an appointment. And sometimes just ongoing assistance with providing some advisement in terms of, accessing an agency that they are not familiar with. It's very helpful. And then talking about all the services available within the Department of Rehabilitation. And it's really a fantastic agency to help young people and adults who want to work or continue their education. And here again, the range of job opportunities, services available through the Department of Rehab. And talking about the array of employment, job training programs they have, short-term employment, internships, on-the-job training, apprenticeships, and just plain interviews to, like, for example, help someone put their resume together, how to interview for a job, just a whole array of services to help people with disabilities get a job, be employed. So again, in here, you know, the array of services like money management, which can be a huge need for young people who haven't really had to do that before, or understanding information on a paycheck, or learning to communicate more appropriately. And there was a survey, where they have followed young people out of special ed into work environments, and the major reason for them being terminated in a job was due to soft skills. And what does that mean? Not the job itself, but the soft skills. And that meant problems with communication and social skills. So it's really an important aspect of moving forward. And then again, other opportunities available to help people with getting employed. So what I'd like to do is look at the chat and okay, and see what, oh, here's all, yes, thank you, thank you, thank you. Now, of course, and you'll notice that I didn't say too much about the regional center. As the regional center, you know, that's a resource that most of us in the field are familiar with. So I really wanted to focus in on resources that intersect with the regional center network, and resources that sometimes aren't discussed, aren't referred to. But the important point I want to make here is that health is not relegated to a healthcare setting. Health encompasses all aspects of life. So as providers, as consumers, as parents and caregivers, thinking about all those other resources, referrals that can be made to assist adults with IDD to be successful in a myriad of different settings. So I see that Crystal has provided just a lot of links to the resources here. I'm just reading some comments here. Tammy wrote, I love the Jan. It works for so many type of interactions, and it gives a person confidence when relating to individuals with disabilities, because you have many hints on particular types of disabilities, and it is a great resource to be sure. Let's see. Anybody have any questions at all? Sort of looking at all the resources, and I see one comment from Tammy. Any hands out there, or somebody want to write something in the chat? Regional center is for when there are no generic funding, but there's a need that is not being met. Thank you so much, Dorina, for bringing that up. Very important point, to be sure. Absolutely. All right. So what I think we'll do, we'll take a real short break here before our next presentation. So you have a little bit of a breather here. And our next presenter is Joan Chang, and she'll be talking about immigration, public charge, and benefits for undocumented individuals. So we'll take a break here. Be back.
Hi, everybody. I'm going to be introducing our next speaker, Joan Chang. We're very excited to have her. I'm just going to go ahead and share her bio. So Joan Chang is a senior staff attorney at Community Legal Aid SoCal's Health Consumer Action Center. She has over 14 years of experience in public interest and private practice. She has a deep commitment to ensuring Orange County residents get access to the health care they need and deserve. She advocates for her individual clients and overcomes systemic healthcare barriers affecting all Californians. And Community Legal Aid SoCal is a proud member of a statewide collaborative of other legal aid agencies called the Health Consumer Alliance. Joan is a member of the Health Consumer Alliance's Race and Equity Committee and LGBTQIA+ Committee. Joan received her JD from Southwestern Law School and her BA from the University of California, Berkeley, and she's a proud mother of 2 young children. So thank you. Thank you so much for being here. She has a really excellent presentation, and I will pass it on to her.
Thank you, Christine. Hi, I know that you've all had a long day, and I'm just kind of popping in here for this section, but hopefully everyone take a deep breath. I know you guys just took like a 5-minute break, but take a deep breath. I'm gonna load up some PowerPoint slides. Christine or someone can just kind of monitor the chat if there are any questions that come in. We could do questions at the end of the presentation, but if you have questions during, like on a particular slide, just let me know, but I'm not going to be able to look at the chat while I'm sharing screen. All right, but let's take a minute. It's Friday. It's been a long day. You know, let's take a minute to kind of center and to breathe. Sometimes I literally have a post-it on my monitor to say deep breaths. So it's a reminder that I personally need. Okay. Okay, can y'all see this, the PowerPoint presentation?
Yes.
Okay, it says public benefits for undocumented immigrants.
Yep.
All right, wonderful. I'm gonna periodically ask if folks can see the PowerPoint because sometimes there's technical glitches where we're not all on the same PowerPoint slide. And I'm a big fan of the laser pointer. And so can y'all see this, the laser pointer here?
Yes.
Okay, wonderful. Okay, again, thank you for the introduction, Christine. I am a staff attorney here at Community Legal Aid SoCal. We serve Orange County and Los Angeles County, Southeast LA County. I'm specifically in our Santa Ana office and specifically in our health unit. So just keep that in mind. We do just a kind of a plug for our office. You know, we serve again Orange County residents, all cities in Orange County, and a sliver of Southeast LA counties. All right, so let's dive in. CAPI. CAPI stands for Cash Assistance Program for Immigrants. Again, I apologize if some of this is kind of old information for y'all, but I don't know everyone's kind of level of understanding for some of these programs. So we're going to go through some basics, but please feel free to ask me questions along the way. All right, so let's dive into CAPI. What the heck is CAPI? CAPI is state funded, so keep that in mind. It's not the federal government that's providing this cash aid benefit. It's California. It's a California funded program that provides monthly benefits to those who technically would be eligible for SSI, Supplemental Security Income, except they don't have the immigration status that SSI requires. In California right now, these are the 2023 amounts. CAPI benefits for those who are either elderly or disabled for a single person is approximately $1,100 per month. And for a married couple, $1,900. This can vary, again, depending on where you live, what kind of home or residence or facility you live in, depending on your income status, and obviously if you're single or married. All right. All right, so here are the 5 criteria or criterion for CAPI eligibility. And we're going to go through and dive into each of these categories, but it's to be aged, blind, or severely disabled, and we're going to talk about exactly what that means. Immigration status and just particular types of immigration status that's required. You have to be a California resident. There's an income and asset limit, and you actually have to technically be, quote, ineligible for SSI. So let's dive in. Okay, aged. Aged is considered 65 and older. So if you're 65 and older, or, so I should have put an or in between each of these categories. You can be aged or blind, and blind is legally defined by the Social Security Administration on what, quote, legally blind means. and then severely disabled. It is a specific legal standard that is severely disabled that's set up by the Social Security Administration. It can be a physical or mental impairment that prevents you from, essentially what this definition means is that you're not able to do full-time work or full-time employment, and it has to be a condition that lasts for at least 12 months. So if you had some sort of injury and the doctors anticipate you're going to be recovering in 6 months, you're not going to be eligible for CAPI because it has to be a disability that lasts at least for a 12-month period. Typically for developmentally disabled folks, they would be within this definition. It just depends on kind of the functioning of that particular individual, but I've had plenty of clients who have received disability benefits due to their developmental disability. But it is, just keep in mind, it's a pretty high legal standard. You can't just have high blood pressure and expect to be receiving CAPI. All right, so this is, I know, a lot. Christine has a copy of these PowerPoints, so I'm not expecting you to, digest all of this, but I want to make sure that everyone understands all of the different immigration status categories that would be eligible for CAPI benefits, for CAPI cash. There's two kind of categories. There's a qualified alien and a permanent resident under color of law, what we call PRU-CAL. I'm just going to highlight a few, but it's folks who are non-residents who are lawfully admitted for permanent residence. Some other examples: Cuban Haitian entrance status. For those who have particular refugee status, I'm not going to go into too much detail about these things because immigration law can be a bit dicey, but it has to be a particular refugee status, a particular asylee status under these particular immigration sections. This one I would like to highlight too: battered non-citizens or children of battered spouses or parents of battered children with a pending petition. So typically it might include those with those who have filed for and applied for but are pending a U visa status. So just keep that in mind. You don't necessarily have to have the U visa to be eligible for CAPI benefits and CAPI cash. All right, so there's also these PRU-CAL categories. PRU-CAL folks are, again, permanent residents under the color of law. So it's basically for folks who the federal government knows that you're in the US and currently doesn't have any sort of plans to deport you. That's kind of the basic summary of what PRU-CAL may mean. I know there's a legal definition of it according to immigration law, but that's kind of the easiest explanation. I'd like to include, these are non-citizens who have been granted a stay of deportation. Keep in mind, PRU-CAL folks can also include the DACA individuals, those who have received deferred action status. But I do have to indicate, the title of our presentation is Undocumented. If you do not fall within these qualified alien categories or any of these PRU-CAL categories, unfortunately, you would not be eligible for CAPI cash. If you have zero status and you don't fall within these categories, unfortunately, you would not be eligible for the CAPI program. Again, California resident, there's no specific time frame how long you have to be in the US. Essentially, you have to physically be here in California, and you have to have an intent to stay indefinitely. The resource limits, sadly, it's pretty low, but for an individual, you can't have any assets or countable assets and property that's more than $2,000, and for a couple is $3,000. So really, California really puts the burden on folks to be quite low income and low asset to be eligible for this program. And we talked about this. If you are granted CAPI for an individual, it can be at a maximum of 1,100 and a couple 1,900. All right, and then the last category or the last requirement is you have to be technically ineligible for SSI due to immigration status. So technically that means you have to actually have a pending SSI application or some sort of proof that Social Security had denied you, because typically they will ask for that sort of documentation. How to apply? You apply through your county. So you apply through your county social services agency. In Orange County, it's Orange County Social Services Agency. For LA County, it's LA DPSS, Department of Public Social Services, but it's your local county social services agency. They handle it at the county level, but the actual funding and the money source is coming from the state. You can apply via mail, via phone, and in person. So if you are denied eligibility for CAPI, you do have a right to an appeal. It's what they call it is a state fair hearing. It has to be filed within 90 days of the notice that said, you know, you're not eligible, you don't qualify. So just keep that in mind. There's a 90-day deadline to file for a state hearing request. And if you do need assistance with filing a CAPI hearing appeal, contact your local legal aid office. Again, if you're in Southeast LA or LA County or Orange County, feel free to give us a call. Okay. All right. Before I go on, I just wanted to stop here and see if anyone had questions about CAPI before we move on to the other public benefits.
Yes, John, I have a question. And those requirements are for the child or for the whole family?
It would be for the person who's applying. So if it's going to be the child with the developmental disability, it's the child.
Okay, thank you.
Yes. So keep that in mind. If the child is, you know, has legal status, you know, they may not be actually applying for CAPI. If they are U.S. resident, but their parents are not, it's the child who's the applicant. So they may very well be eligible for SSI. So just keep that in mind. Okay. All right. Other public benefits for immigrants. Let's this is not a complete list. I try to do my best in including some major public benefit programs, but keep that in mind. It's not a complete list. So there's WIC, Women's Infant and Children Program. WIC provides essentially nutritional training and information for pregnant persons and parents. And honestly, the biggest benefit for WIC are they give you cash benefits to be able to purchase food. There is a misconception that WIC does provide free diapers. That WIC doesn't, but typically if you go into an agency, a WIC agency or WIC office, they will connect you to various nonprofits that do provide free diapers. For WIC program services, you don't have to have any sort of immigration status. So no matter what your immigration status is, you would be eligible, as long as you meet the other requirements for WIC, you'd be able to receive WIC services. Okay, so that's WIC. We're going to move on to CalFresh. CalFresh, AKA food stamps. Food stamps in California are called CalFresh. That's just we like to add Cal to everything in all of our state programs. So Medi-Cal, CalFresh. I'm not going to go through all of these, but these are the folks who would be eligible for CalFresh. Obviously, if you have a green card, a citizen, if you have that refugee asylum status, if you have or are applying for a U or a T visa, all of these folks would be eligible for CalFresh. Unfortunately, the folks on this side are not eligible for CalFresh. So that would include folks who are here in the US on a student visa, a work visa, or a tourist visa. And unfortunately, DACA folks are not eligible for CalFresh benefits. And then TPS, temporary protected status. Again, unless you have other status in this side of the chart here, you would not be eligible for CalFresh. And again, if you have 0 status and don't have any documentation, then unfortunately you would not be eligible for CalFresh. But keep in mind, just like the question that I just got, if say for example, a US born child can apply for CalFresh on behalf of the household that may have undocumented family members. So just keep that in mind. I'm sure y'all are, some of y'all are coming from regional centers, and so immigration status does not matter for regional center services. I just want to put that in here and reference Disability Rights of California and their wonderful website on the Lanterman Act. They have a lot of great FAQs on it. But essentially for regional center clients, immigration status does not matter. This one I had to look up, but I know this is a question that y'all have had for California Department of Rehab Services. Unfortunately, you do have to have authorization to work in the US. So if you're completely undocumented and don't have that authorization to work, then unfortunately you would not be eligible to receive Department of Rehab Services here in California. But if you do have a work visa, that's good enough for DOR to provide you those services. All right. Okay, before I move on to Medi-Cal, any questions? Okay, thank you.
I think we're good. And thank you for the, we had a lot of questions about DOR and immigration status at our last summit. So thank you so much for clarifying. But
oh, of course. Yeah, I had to do the research myself. So
thank you.
I learned from this presentation myself. All right. So Medi-Cal for the undocumented. There's been a lot of great expansions in the world of Medi-Cal for undocumented individuals. So let's kind of talk about them. Previously, before these expansions, if you did not have immigration status, you were restricted to what they call emergency Medi-Cal or restricted Medi-Cal. You essentially would only have coverage at a hospital. If you went to the ER or had hospital bills, Medi-Cal would only pay for emergency services. But now that we've had these expansions, let's talk about them. So for those who are 25 years and younger, if you have no immigration status, you are eligible for full scope Medi-Cal, meaning, you not only get coverage for emergency services, but you're able to get drug coverage, prescription coverage, be able to see your primary care physician, get ABA therapy, get speech therapy, get physical therapy, all the wonderful things that full scope Medi-Cal provides. This was expanded in January of 2020. All right, and because we live in this wonderful, great state of California, we've expanded it even further. Last year, we've expanded it to what we call the older adult Medi-Cal expansion. So for those who are 50 and older, no matter what your immigration status is, you're now eligible for full scope Medi-Cal. And to come next year, January 2024, everyone, essentially, Medi-Cal, full scope Medi-Cal will be eligible for all individuals, no matter what your immigration status is. But like I said, in the meantime, if you're in this age range from age 26 to 49, you're still eligible for what we call emergency or restricted Medi-Cal. All right. So this is some details about this. For those who actually turned 26 during the pandemic, essentially Medi-Cal and the state had confirmed with us that they'll be able to continue to be covered by full scope Medi-Cal until the full expansion in January 2024. All right. this is something I threw in. This doesn't have to necessarily deal with undocumented or documented individuals, but if you have Medi-Cal, there is a legal standard that changes once you turn 21. So for Medi-Cal services, once you do have Medi-Cal, what happens when you turn 21? Let's look at this fun chart that I have. So for Medi-Cal, Medi-Cal will cover what they call are medically necessary. Medically necessary, there's a very particular legal definition of what medically necessary is. If you are under the age of 21, this is what we call the EPSDT standard. It's an easier standard. When you are an adult, when you turn 21 and older, the standard is a little bit higher. For example, I like to give this speech therapy example, which I had a real life client experience this. For speech therapy, if you are under the age of 21, all you have to show is that speech therapy is needed to maintain. So meaning, say for example, you had a bunch of language tests that were done and your score was 50 when you first started speech therapy, and then 50 a year later. You're not showing necessarily improvement, but you've at least maintained that 50 score, that 50 level. That is enough for Medi-Cal to continue to provide you speech therapy services. However, once you turn 21, you're now subjected to the adult standard for Medi-Cal, which basically means you have to, for the most part, especially in the speech therapy context, you would have to show that you are improving with speech therapy. So that same individual who was still scoring 50 last year and 50 a year later with speech therapy services, unfortunately, their speech therapy services might get cut off because they're not, quote, showing improvement or they're not improving. So keep that in mind. I've had clients who have lost ABA therapy and speech therapy services once they turn 21, because unfortunately the legal standard is higher and they are not able to meet that legal higher standard. And this is just the law and the regulation. All right, any questions about Medi-Cal, in the world of Medi-Cal, before I move on to public charge? Okay. All right, so what the heck is public charge? Speaking of, undocumented or immigration status, public charge is currently defined as a person who is or is likely to become primarily dependent on the government for support. So public charge, there is a public charge analysis and it applies to a certain group of folks, and we'll talk about that in a minute. Public charge. To summarize this slide, public charge is like a multi-factored analysis. They're going to be looking at not just one thing, but a bunch of things. They're going to be looking at what your age is, what your health status is, your family and financial status, your education, and your skills. They're going to look at all of these factors, not just one thing or one factor, but all of these factors, among other factors, to determine if you are a, quote, public charge or not. So let's talk about who the heck public charge applies. Sorry, this is affect. Okay, affect. Sure. Public charge only applies to these three groups of folks. Okay. Public charge only applies to, number one, a non-US citizen who is applying for a visa to enter the US. So if you're outside the US right now and you're trying to get in and you're applying for a visa, you would be subjected to a public charge analysis. The second category is the more likely one, since these are folks who are in the US currently, but a non-US citizen who applies for a green card. So a green card, AKA a lawful permanent resident status. So for those who are applying for a green card, that's when a public charge analysis will take place. And then the third category is if you are already a green card holder, but you left the US for more than 6 months and you're trying to re-enter the US. So I showed this picture because, you know, typically for a green card holder, you know, you're not allowed to be outside of the US for more than 6 consecutive months. If you are, then you might have some, you know, you are technically subjected to a public charge test. I've never had this happen for any of my clients, but theoretically, you know, you could be asked about at the airport before you enter the US at the US airport. You know, they can ask you questions like, hey, do you have Medi-Cal? Are you on Medicaid? Are you receiving cash aid? They're going to start asking you all of these questions that might go into this public charge analysis. But let's talk about what public charge, who public charge does not apply to. So public charge does not apply to US citizens. So if you're already a citizen, you don't have to worry about this stuff. If you're applying for citizenship, you don't have to worry about public charge. Again, for most people with green cards who already have green cards, you're good to go, except again, in the scenario where you went outside the US for more than 6 months and you're trying to come back in. And then public charge also does not apply to this long list of other folks, asylees, refugees, all these other folks with these types of statuses. It also includes folks who are renewing for DACA status. There's a longer list, but I didn't include it. But there, again, just keep that in mind. Folks, public charge typically only applies to these categories. Public charge will not apply to these folks. All right. Okay. Let me move my little cursor here because I don't know what this says. Okay. Only 2 types of public benefits are considered in the public charge test. All right, so let's talk about it. Public charge, essentially, these 2 types of public benefits can ding you for public charge. Oh, hold on here. All right. So cash aid, if you're receiving cash assistance that's ongoing, things like SSI, things like the CAPI cash aid that we just talked about, TANF, which is what we call CalWorks in California. Again, we love to stick Cal in front of everything. TANF, AKA CalWorks in California, General Relief, General Assistance, GAGR, any sort of cash assistance program. If you're getting it, you might be, you know, public charge would apply to you. And the second category is if you have Medi-Cal, not just the fact that you have Medi-Cal, but if you have Medi-Cal and Medi-Cal paid for your long-term institutional care. So if Medi-Cal has paid for your nursing home care, then the payments that you know, Medi-Cal and the state has paid for your nursing home care may be considered a quote public charge. So keep that in mind. Cash and Medi-Cal for nursing home. That should be kind of the bottom line. The next slide actually talks about what government or public benefits don't affect your immigration status and are not considered a public charge. So this list is longer, so keep that in mind. So you can have Medi-Cal, as long as it's not Medi-Cal for a nursing home, you're good. So if you're using Medi-Cal to pay for ABA therapy, for speech therapy, for your medications, anything that is not connected to nursing home care or long-term care, you're good, you're fine. The CHIP program, IHSS, I know some of y'all and your clients might have IHSS, in-home supportive services. IHSS is not considered a public charge benefit. So it's safe to receive IHSS. Also, any sort of state home and community-based services or waiver programs, you should be good to go. COVID assistance, if you got any sort of free COVID testing, treatment, or vaccines, or any of the pandemic stimulus checks, or any of those pandemic public benefits that you got, those are not going to be considered a public charge. And Covered California, for those who have Covered California with what we call APTC, which is basically like a monthly premium deduction or premium discount. Having covered California and having these tax credits does not make you a public charge. This list is longer, which is good. Any sort of food assistance, so CalFresh, aka food stamps, any sort of free or reduced school lunches, you don't have to worry about public charge. Food banks or free meals on wheels, those are not a public charge. And again, WIC is also not a public charge. Earned income and child tax credits is not a public charge. And housing, if you're receiving assistance at a homeless shelter or you have Section 8 housing, those things are not considered a public charge. So keep that, it's safe for you to receive all of these benefits and services. This one, and then let me go back to the previous slide. All of these, you're safe to receive those benefits. You just have to worry about these. Cash aid, and then again, Medi-Cal for long-term care. Okay, so a little quiz here. Feel free to, if you can monitor this, Christine, in the chat.
Sure.
Does public charge apply to me? So if you and your family members are US citizens, would public charge apply to family members who are US citizens? Yes or no? Am I seeing yes or no's?
Getting no's in the chat.
Yay, love to hear it. Okay. Public charge does not apply to these folks. So again, if you're a US citizen, you don't have to worry about public charge. What if you or your family members already have green cards, legal permanent resident status? If you already have green cards, does public charge apply to you? Yes or no?
Getting no.
Public charge does not apply to you. It may apply, again, if you leave the country for more than 6 months. And again, sometimes this does happen. I've had a client who was, went to Vietnam to take care of some family members. And because the family member ended up getting hospitalized and was sick there, ended up staying for about like an 8-month period. So she didn't have any issues with public charge when she came back, but technically, they could have applied the public charge test against her. Okay. If you are applying for, or if you already have any of these statuses, U or T visa, asylum or refugee status, or a special immigration juvenile status, would public charge apply to these folks? Yes or no?
We're getting no's for that one.
Right. Yes. No, public charge would not apply to these folks. And then this is a little bit dicey, and I'm not going to go too much into it, but do you plan to apply for a family-based green card? They're applying for a green card. They're applying for LPR status, legal permanent resident status. Would public charge apply to someone who is applying for a green card, family-based green card, or any other green card? Yes or no?
So a little bit of a mix, but more yeses.
Okay. Yes, public charge most likely will apply in that scenario. So just keep that in mind. They can take into account the fact that you are receiving cash benefits from SSI or from CAPI, or receiving CalWorks from the state. Those things are one of many factors that they can consider to see whether or not you are a quote public charge. But just the fact that you're receiving, let me go back here. Just the fact that you are receiving one of these cash program benefits doesn't automatically mean that you're going to be denied a green card. It's, like I said, one of many factors that they're going to be considering in your public charge. Okay. It's not an automatic no, I guess I should say. And that's it. I have some of the cited resources. this website really is really great. You could do a personalized screening for whether or not public charge applies to you in your particular situation. So I'll include these all in the slides, and I just include our information. Again, if you are in Orange County or Southeast LA County, feel free to call our 1-800 number. Our services are free. And oh, I do have this. Feel free, you don't have to do it, but let me stop sharing. We have a survey on how I did, so we can improve. I'm gonna put it in the chat. Presentation survey. Let me know how I'm doing.
Thank you so much. That was really, really great.
Any questions about public charge? I know I threw a lot of info at y'all, but I'm happy to answer any questions, or if anything else comes up, Christine could relay those questions over to me.
There were 2 questions that were during the presentation that we didn't get to. One was for Cappy to apply, do you need a social security number?
No, you do not. And typically folks don't have a social security number because of the nature of the program. Yeah, you do not need SS, or yeah, you don't need it.
Okay.
What was the other one?
The other one was, does anyone know about the 250% working disabled working program, and how do I enroll in the program? And
I don't have a slide on this, but yes, we deal with this on a regular basis. The 250% working disabled program is like a Medi-Cal program, a specific Medi-Cal program or particular aid code, where if you are receiving disability income and you are quote working, and I put work in quotes because for working disabled program purposes, work can be, in the past, I've had clients recycle cans and they just bring in a can recycling receipt. Or, I've had clients like get paid cash to do hair for their neighbors. I've had clients in the working disabled program who got paid like $5 a month to take in the garbage cans for their neighbors. Work is defined pretty loosely, but if you're able to show that you are quote working and you have disability income, all of your disability income is not counted for Medi-Cal, which is great because some folks who have a lot of disability income may make them over income for free Medi-Cal. But if you're enrolled into the working disabled program, they don't count any of your disability income. So if you have more questions about that, I'm happy to dive in more. Feel free to give us a call. Yeah, we regularly assist folks and screen folks for the 250% working disabled program.
Okay, that's great. And then Alina Du has a question. Her hand raised.
Yeah, I want, 我想让他再把他的联系方式放一遍，因为刚才我没有记录下来。
Let's see if I think the interpreter is on the other channel, so it may be hard to bring that over.
Karen wants to get your contact information.
Oh, contact information. Okay.
I'll put it in the chat.
Okay. Thank you.
I'll put it in the chat. But again, unfortunately for us, we're only able to assist folks who are in Orange County or Southeast LA County. But if you have a general question, I'm happy to answer it too. But let me give you community equal aid. I'll put it in the chat, our telephone number.
Okay, thank you. And the other question in the chat is that do you know if the CAPI funding?
Thank you.
Thank you.
Thank you. That's a great question.
Yeah, do you know if the CAPI funding has been reduced with the governor's review of the budget?
Yeah, and that just came out. I honestly don't know. I'm not following that. I
And they'll-
honestly don't
there'll
know. So
probably
I don't want
be
to give you wrong information.
changes too, like back and forth before it's final, whichever way it is. So, okay. And then Lorena, Guadalupe, Lorena.
Hi, thank you. It was been a great presentation. I really enjoy everything because I deal with families every day, especially families that are afraid to apply to any services because they're in the process or they're going to apply or they're being here like for 4.5 years, so they don't want to mess up what they had here. So we always deal them, and they're always afraid because the issue that they have is that they changes at the beginning, you know, if you apply for food stamps, that was public charge. And then if you apply for Medi-Cal, that was public charge.
Yeah.
So it's hard for me to convince them, no, it's okay if you apply for this, but don't apply for the cash, you know, but apply for this because I seen that they really, really need the services special for housing, or they're going to be homeless, or they're, you know, they don't want to go to a domestic violence shelter because they're afraid that, you know, they at the end they're going to have to, you know, tell them what you know, if somebody paid for that and all that. So it's very important for us to get our community, you know, informed. But also, do you see any changes coming to the CAPI program anytime soon? Or the public?
So to kind of address your first point, yes. So just if I didn't include this in the presentation, but to provide context, during the Trump administration did change the public charge rules, which what Guadalupe was mentioning, made just the sheer fact that you had Medi-Cal, Section 8 housing, the categories that are no longer counted against public charge were considered against public charge. So, but that rule, since the Biden administration has taken office, that rule no longer applies, and it's going back to the old school public charge rules, which is what we talked about, only receiving cash benefits or Medi-Cal with long-term care. But sadly, during the Trump administration, those other categories that were off limits were on limits. So, you know, a lot of folks were scared to just have Medi-Cal. I've had clients call me and say, hey, I just want to cut off my Medi-Cal because I'm worried about how it's going to affect my immigration status. And they already had green cards. So the public charge didn't even apply to them, even the old Trump rules. So we call it a chilling effect, which sadly, you know, it scared a lot of folks off. So and we're doing our best to inform clients, do your very best to let folks know it's safe to get those other public benefits that are on the safe list. But unfortunately, CAPI and, you know, those other cash aid benefits are still on the public charge list. But you have to remind them that it's one of many factors. Simply because they're getting the cash aid it's not an automatic denial of your green card application.
Thank you.
I hope that answers your question.
And then one more question in the chat is that can somebody call Legal Aid SoCal and speak Korean? Is there? Okay.
I don't speak Korean fluently, but 한국 사람들 있어요. We do have Korean staff in our office. And if there's a language that we don't speak, in the health unit specifically, we have Vietnamese speaking, Spanish speaking, Korean speaking. I think in our hotline, we also have Mandarin speaking, Farsi speaking staff. But if it's languages that we don't have a staff who actually speaks the language, we use language line. So any threshold languages, we're able to provide assistance.
Okay, great. And is there an agency similar to yours in Northern California?
Yes. Are we talking about the Bay Area specifically or just Northern California? If you could put it in the chat, Bay
Area.
Because that's a different Bay Area Legal Aid. They have a health unit, and I believe they have an immigration unit too. But they have a health unit just like we do.
Great.
I'll put the website in the chat.
Thank you. Yeah, as you can see from the questions, this is incredibly needed and useful information. And so we are very appreciative. Okay, so for Los Angeles, so we talked about Southeastern Los Angeles and Orange County. What
Yeah.
about the rest of Los Angeles, if you have any?
NLSLA. So NLSLA, it's called Neighborhood Legal Services. Neighborhood Legal Services of LA. They also have, I believe they have an immigration unit and a public benefits unit and a health unit, just like our office.
Okay, great. Okay.
Okay, well,
Well, we
if there are
should-
more questions that come up, Christine, feel free
Yeah.
to send me an email and I'm happy to chat with folks.
Okay, thank you. This was really, really helpful. We really appreciate it. And we'll be in touch. Thank you.
Thank you, everyone. Have a lovely day. Enjoy the rest of the summit and happy Friday to you all.
Happy Friday. Thank you.
Thank you, Joan. All right, wonderful, wonderful. So we are at the end of our summit. However, we want to ask you to provide an evaluation of today's summit. We use that information to hopefully plan for summit number 3. So, yes, thank you, Crystal. And the next slide shows we have evaluation surveys in 4 different languages. And we would deeply appreciate if you could, there's only a few questions. If you could fill out the survey and we'll review it. And we take your feedback and input very seriously in terms of planning for the future, and planning what other activities we have in mind. Also, I do want you all to know that this summit will be uploaded on our UCEDD website, and we'll send the link shortly. And so for those of you who think that you'd like to see certain portions of the summit again, because it's like a lot of information we've provided today, it'll be accessible. And also, if you think it would be useful information for others of families, colleagues, self-advocates, we'd appreciate you spreading the word. So other than that, Dr. Mirzayan, can I ask you, is there anything that you would like to add?
No, I just want to say thank you to everybody. And I think we really got a lot of good information today, and I'll look forward to seeing the results of the survey because the ones from prior really helped us plan this event. So we hope to be able to host another, and please provide your feedback.
Yeah. Yes. Thank you so very much. Thank you for your involvement, your questions and comments during today have been really helpful. And please keep them coming in. As we've said, we pay attention to them. So I wish you all a great rest of the day. And I thank you so very much for your participation. Hope you have a great weekend. And hopefully we'll see you next year.